Good morning, everybody. Today's date is Friday, March 13th, 2020. It's about 7:20 a.m. on the U.S. East Coast. You're listening to Coronavirus Central. I am your host, Tom Kaczynski, here giving you the news before it's news and the views that no one else has the guts to tell you. I want to thank all of our listeners who are here with us. We set a new record listeners, so I sort of imagined in the back of my mind there were a lot of people. We've had a lot of people we've kept. We've had a lot of people who've come over here, checked out some of the other sources, and even though you have the problem of my needing to improve audio quality and questionable sense of humor, you've come back because we're all working on this together here. And, you know, one of the things that's so exciting about this podcast is we've been working nonstop to find solutions to let people know how to prevent the worst from happening to themselves and their families. For those who've been listening 2 to 3 weeks, you're prepared for these events. We've begun telling you what sort of medical treatments are being used and being helpful around the world. And all that information is helping not just individuals and families, but doctors, medical researchers, people around the world. And I am so grateful to have been able to be a part of that, and that we will continue to do that going forward as this epidemic moves onward, unfortunately. And we're going to have to deal with a lot of different issues related to that. So for today's show, what I think we're going to cover is, just to give you a quick preview, is I'm going to give you some updates about what's happening in terms of the larger fight against COVID, the challenges that we are seeing, especially from Europe, and with the shortages related to how we're treating this. A question I get asked often from listeners is to share some information about what the actual experience of having coronavirus is like. So we're going to have a story from the New York Post about that today I think will be useful. We're going to talk about some other drug treatments coming out of India that may offer other opportunities as we consider what the best way to move forward is. And then we're going to go into sort of an ugly section at the middle of this. And what I wanted to talk about in that was there's a narrative developing in this conflict between the United States and China over who's going to take responsibility for this that is going to be a big part of this story, because the question of how we deal with the coronavirus outbreak isn't as simple, although I wish it were, as talking about this as a purely medical issue, which it needs to be. Otherwise, the death rate will spike. But with China starting to recover, the United States starting to get sick, and angry domestic populations in both countries, we are seeing an all too familiar tendency to blame each other and different sides for the origins, causes, and response to not just the virus, but the economic slowdowns and the supply chain problems, which threaten social stability in both countries. And in the same way that, a once happily married husband and wife in a divorce will sometimes be kind of rotten to each other, as we see the consequence of globalization occur with inabilities on both sides because of what is happening due to the virus, we see a fraying relationship and increasingly bellicose rhetoric on both sides, which could have very big consequences, both in terms of how the world economy performs, and that will tell you, why the stock market yesterday set yet another record for the worst day in history, going down almost 10 percentage points, but also from the perspective of us who are worried about the coronavirus, what is going to happen with the drug supply, which I would remind you, 97% of our antibiotics and large majorities of the active pharmaceutical ingredients actually do come from China, and which frankly they can and may hold hostage, which has incredible impacts on America, Britain, Europe, wherever you are around the world, the capacity of different countries to have an effective effort against COVID. So we're going to have to talk about that. After that, I'm going to do, in the last segment of the show, we're going to do a really deep dive into Boston, Massachusetts. And I use this as an example of a city, and we're using Boston, but we could use other cities, of what sort of preparations are happening, some good ideas that are being implemented to protect people and to try to mitigate the risk, but ultimately to demonstrate to you that the single most important thing we can do right now is social isolation. I support all the public health measures that have been set out there. Limit your exposure to mass public spaces. Rigorous hand washing at all times. From the beginning, we've been saying you need to use a mask, you need to use goggles. We've reported on the aerosolization of the coronavirus. And in all of this, our goal has been very simple. We want to keep people safe because we care about you, right? We want that to happen, but also because that's how we are going to prevent the spread of this pandemic. And the reality of this disease, which is very difficult, and it's going to be especially difficult for the West, where we don't have the ease of implementing authoritarian top-down solutions, is that we need everyone to buy in. If half the people treat the coronavirus as real, or even 3/4 of people, and 25% of people continue their habits, that population in the U.S. alone is 75 million people, enough to ensure coronavirus spreads everywhere. And as we have that quirk where, you could have a family with 4 people, 3 take this seriously, 1 doesn't, all you need is that one person to serve as the means by which this disease continues to spread. And as it spreads, and we reach that sort of critical point that I worry about, where 1 in 200 people get infected, what we reach is the point of medical no return in terms of our ability to meet certain key factors, such as the availability of antiviral drugs, the availability of ICU beds, and the availability of ventilators. Not to mention the fact that we're going to be woefully short on masks, for at least in the best case scenario, given our government response, for a few months. And hopefully that changes. So we're going to go through it that way. Hopefully that'll give some context for you as we move forward. I want to tell everyone, as always, we have all of our shows up at coronaviruscentral.net. We want you to visit that. If it ever goes down, corona.castos.com. That's up there for you. Twitter is coronaviruscast. We're on Facebook at Coronavirus Central. And we will continue to be having shows, as well as I'll do a show on YouTube tonight at 7 p.m. Eastern Time for your questions, where I opine on things. And with, I suspect tonight I'm going to end up talking a little bit on that show about questions of where this originated from. It's such an important question to understanding this whole pandemic, and it has become so politicized because there's really 3 questions, right? Number 1 is, what happened? Number 2, what are we going to agree upon as having happened, which is often quite different. And number 3, what does that mean in terms of how the response moves forward? And as we always say on this show, our focus is defeat the disease, because when you're fighting someone else, if countries are fighting each other, if people of ideological stripes are trying to win credit for, the upcoming election, you're not fighting the virus, and we need to fight the virus. So we're going to start today, like we always do, COVID19info.live. They've been with us for, we're coming up on 2.5 months now. And this is crazy. This is episode 29 here. I can't believe we've been doing this for 30 episodes. I was kind of hoping that wouldn't be the case, but we're here together, and, that's one of the things we're doing. And I want to thank also everyone who shared those good stories with me. If you have a good story, a success story, a preparation story, a story of helping your community, I want to put some of those out there on Saturday so we can put some hope out there as well. I realize this is a difficult subject, and it's not lost on me that I often hit you with some extremely difficult information. I don't always know what's going to be the most important thing, but I try to give you the benefit of what I'm thinking about, to give you a framework to consider things. And as the news moves forward, we've found that we've often been able to hit the key elements that have been at the heart of this, and that's what we're going to do that's different. It does you absolutely no good for me to tell you what's already happened. It does you a lot of good for me to give you an idea to be ready for what's going to come, because the goal of this is really simple. I mean, I'm not making money doing this, I'd like to, but I'll work on that. It's really to make sure that you come through this alive, and that you come through it safe, and that we come through it together, and we're all on one team now. So, and right now, some of our team members are getting shellacked. So we are looking at, let me update this for the time here real fast. So this update is as of 7:20 a.m. on the U.S. East Coast. We have 137,849 confirmed cases, 5,097 confirmed deaths. China seems to be acting as if they have this fully under control. There's a lot of concerns about reinfection about that, and their desire to get the economy back. We're going to talk about China a lot today, because I think it's a key part of the story, and also in terms both of expectations of what might follow if we get on the other side of this, but also how we manage our own response to it, and the medium to long-term consequences of this, which are a part of the story we just can't overlook, because supply chain issues, economic breakdowns, the Great Depression killed a lot of people too, and we may be heading that way as the Dow slumps toward 20,000 as we predicted. And I'm thinking at this point it's probably going to go down at least another 5,000 points after that. But hopefully you're not too invested in that, and if you are, sorry, it's not going to be a good day for you. Okay, so we got mainland China, 80,932 cases, 3,177 deaths. Really just pretty much settled at this point in terms of what they're reporting. Italy is the big, I don't want to say winner, but it's the big mover here. 15,385 confirmed cases, 1,016 deaths. That's a 6.6% death rate. Obviously, that's a little bit high, given that people are just starting to go into the disease, and that will probably flatten as we have some time to look at it just a little bit, except for the problem of the hospitals being overrun. We're going to mention that in passing. Iran, 12,364 with 541 deaths. Saw an article in the New York Times that I will post here about how many people were dying in Iran. They were literally building huge burial fields. In fact, I brought up an article on it, so I'll mention it in passing, because it really suggests that those numbers are incredibly low, which we suspected from China as well. That a lot of people who were looking at it at the time the outbreak was happening was thinking that the numbers were reduced by at least a factor of 10. And based on what we're seeing in Italy and what we will see over the next couple months, and the projections we have from various epidemiologists and virologists around the world, which we've been reporting, this idea that if we're going to have 40 to 70% of the people get infected, or 20 to 50% like the U.S. Senate attending physician has said, we are going to see these massive death tolls. And the idea that China somehow escaped them without having the benefit of previous experience stretches the imagination. Let's say it that way. South Korea, 7,979 cases, 72 deaths. So South Korea's done a really good job getting in front of this. We've talked about them a little bit. People asked me on Twitter last night, what does South Korea do right? And it's pretty simple. They get in front of this. They test everyone to figure out who has this. They separate the people who have it, and they connect them through contact tracing to those who don't. And they have an active testing ability. They have these drive-through test sites where they test 20,000 people a day, and they avoid the problem of hospital contamination that way. And they're going around, and they have developed protocols to help people earlier in the earlier in the disease intervention process that has mitigated the death rate. Now, admittedly, they're ahead of the game in their testing, so that death rate might spike a little bit, but the fact that they have a protocol, like we reported on yesterday, of chloroquine, zinc, and there are other ones out there. There's remdesivir. We'll talk about the Indian protocols. There's some other ones that are out there, but ultimately they have a way to mitigate this that they're looking at, and the problem is, in an active, proactive mindset, you can do that, right? In the United States, Europe, and a lot of other countries, what we are seeing is a reactive mindset where they're telling the hospital system, is telling the patients, or prospective patients, A, we don't have tests, or we don't want to test you, and then B, that we only want you to come in if you're in a critical case. Well, the problem is, if you had intervened earlier and you had a protocol and the drugs to do that, and to be honest, the West probably doesn't have the drugs for the level of population who's going to get this, but if you did, which South Korea seems to be managing, what they're doing is they're turning some of those severe cases and critical cases potentially into ones that are less bad by basically buying the body's immune system time to fight off this virus. It's very important to remember as we talk about this, there's no cure for a virus. What happens is that you have the ability to fight it off in your system, so you fortify that. That's why people say take vitamin C, vitamin D. Anything you can do to fortify your immune system is helpful, and anything specifically to strengthen your immune system and your T cells, part of your lymphocytes and your leukocytes. But anyway, so that's what South Korea is doing well, and they're reaping the benefit of it. Conversely, we are seeing in Europe the opposite of that. So Spain, 3,148 cases, 87 deaths. France, 2,889 cases, 61 deaths. Germany, 2,750 cases, 6 deaths. The United States now, we're moving up quickly, 1,762 cases, and 41 deaths. And I have to tell you, that number has to be low, not just for mathematical modeling reasons, but I get at least 10 to 15 stories per day of people who tell me from different hospitals around the United States, cases that just haven't been announced yet, and about 90% of those actually come true. So if it isn't in a community near you, it soon will be. We have community spread, no contact tracing. The United States, to the extent you are out and participating with people, is going to be full of people who have this. Now, statistically speaking, it's still a small number, but in terms of the aggregate of the U.S., the situation is enough where, like they say with these mitigation strategies, this is going to be spreading everywhere. And we see that in all these European countries. And let's look, all the European countries jumping up because we have open societies where people are prioritizing their level of comfort and going out and doing things and not practicing social distancing and not wearing masks. It may be, when this is all done, a big part of the narrative of why East Asia ended up being less badly hit than the West is the experience of SARS and other diseases, as well as potential air pollution in some areas, had habituated the populations there to wearing masks on a regular basis. Americans, Europeans, all these different countries have not adopted that. And as we reported yesterday, this sits as aerosol for 3 hours. We have super spreader events like the Shincheonji Church, or today we're going to talk about the Biogen conference in Boston that's at the heart of the Massachusetts cluster that is now to the point of likely being community spread. So we're going to talk about all those things so that you understand that the thing that you absolutely have to do to stop this at this point is, if you can't trace back every single case, and we probably can't if we're really honest about it, you have to shut it down. And you have to shut it down sooner rather than later because, as we already know, depending on the numbers you want to use, you're going to see case doubling every 4 to 6 days. With this level of interaction, people running around panicking, one sick person goes into Costco, goes in there, coughs at the front of the line, every person going in there to get their 12 tons of toilet paper is going to get sick. That's a dangerous position. Hospitals, healthcare providers. My wife and I actually, we had a doctor's appointment here in Maine, so we called up the Maine General System and wanted to see what precautions they had in place. They're like, oh, we'll be getting those next week. You'll be getting them after they'll protect you. The healthcare providers will get sick because the sick person will come in there thinking they have the flu, or a whole bunch of people who have the flu come in there thinking they have coronavirus. And what has been the response in some places? Well, just don't come to the doctor. So you can see that this lack of a coordinated strategy is so dangerous. And it's going to be especially bad in the United States because we have a decentralized healthcare system. And I will say, and I've heard from a number of medical practitioners, given that they are not being allowed to practice medicine safely, they're not going to show up. Now, I'll give you one example. It's anecdotal, but it's telling. I was talking to a prominent doctor in a U.S. community, and he was telling me that, he wanted to be able to go into work and safely and to wear a respirator mask, one to protect him and protect his family. And his hospital said that they would not allow him to come in there with that because it would, quote, scare the patients. And so what did he do? He decided to take off indefinitely rather than put himself and his family at risk. I don't blame him for doing so, because how can we expect to ask our first responders, our medical officers, our doctors, our nurses, everyone involved in that process, to not even take care for themselves lest we spread panic? Panic comes from when you have situations you can't anticipate. And this idea that we are trying to stage manage this crisis, which has honestly been the ongoing problem. We see people complaining about the Europe travel ban in the United States. We need to ban everywhere traveling, including within our country, if we want to stop this. But people are still playing politics with it, And as long as people want to do that, as long as people are figuring out how they can gain the disease wins. And that's where we're at. And, you're seeing this throughout the West. I mean, it's really exploiting our societies. Switzerland, 868 cases, 7 deaths. Norway, 812 cases, 1 death. Denmark, 785. Japan continues their jump. They're becoming very westernized in what they're doing, unfortunately for them. 711, 19 deaths. Sweden, 688, 1 death. Netherlands, 614, 5 deaths. UK, 596, 10 deaths. Belgium, 556, 3 deaths, and Austria, 428, 1 death. And those are the countries that are in the absolute worst of it. Some of the countries that are starting to jump up through the ranks here, Australia's at 160 with 3 deaths. We have Canada at 158 with 1 death. We said Austria. So Singapore has held really strong. They were one of the first countries really infected. 187. They have been on top of it. And you're starting to see this spread into other parts of Europe too. Finland 155, Greece 117, Czech Republic 116, Iceland 109, Slovenia, which is a very small country, 96. And a lot of these other countries in the Middle East are in the 60s and 70s, but I'm not sure how accurate the case accounting is. India is making a jump here a little bit, 74 with one, Ireland 70. So all of these different countries, Poland's up to 51, and I think these numbers are just trailing. And as we said a couple weeks ago, if you have poor case management out there and you don't know how many cases there are, you got to figure there's probably at least 20. And when I say at least, I literally mean at least 20 cases times the amount you see out there, unless you're a country like South Korea where you're actively checking. And we know that these countries are not doing this, and they didn't think they had the ability to do so, and whether through, for whatever it was in their assessment that made them do that. So this is what has put us into sort of a rough spot. And I give you that sort of world update and sort of an overview before we go into a couple pieces of news I think are relevant. You have to forgive me, I'm a little sleep deprived. I'm definitely looking forward to the weekend to recover, but I know you guys count on this, so I'm going to try to hang on with you because it's going to be a long haul. We're going to need to keep ourselves going. This is from Bloomberg. It's from Claire Che, and the article is entitled "Coronavirus Can Live in Patients for 5 Weeks After Contagion." Patients with the new coronavirus keep their pathogen in their respiratory tract for as long as 37 days, a new study found, suggesting they could remain infectious for many weeks. And yet another sign of how difficult the pandemic may be to contain, doctors in China detected the virus's RNA in respiratory samples from survivors for a median of 20 days after they became infected, they wrote in an article published in the Lancet Medical Journal. The new coronavirus has spread to 118 countries and infected about 125,000 people since first emerging from Wuhan, China, at the end of last year, evading drastic efforts by local authorities and subsequent containment efforts in other countries. The findings have, quote, important implications for both patient isolation decision-making and guidance around the world about the length of antiviral treatment. Fei Zhu from the Chinese Academy of Medical Sciences and the other authors wrote. Currently, the recommended isolation period after exposure is 14 days to avoid spreading the virus. But if people remain contagious long after the symptoms have vanished, they may unwittingly propagate the pathogen after they return from quarantine. By comparison, only a third of patients with SARS still harbored the virus in their respiratory tract after as long as 4 weeks, the Chinese record said. The Chinese scientists said. They studied the medical records and laboratory data from 119 COVID patients treated at Jinyintan Hospital and Wuhan Pulmonary Hospital, including 54 who died from the infection. So, all right, what do we got here? We got that there's an average that the people are shedding virus for 20 days and some as long as 37 days, or let's call that 5 weeks, after this infection. So there's two questions here. The first question, which is important, is just because they're shedding virus theoretically doesn't mean that they are contagious and getting people sick. That's actually a question that has to be asserted separately, and there'll need to be more research. As far as I can tell, this study does not specifically answer that question. It's something we will need to know, but I am going to make the assumption, as I often do in the interest of safety, that despite the fact there are many viruses that do shed afterwards and are not contagious, we don't know what we don't know. So I'm going to assume, in terms of optimal safety, that as this article suggests, that that's something you need to factor into your calculations, the potential that as long as basically 3 or 5 weeks and an average of 3 weeks, the people who have this are still shedding this, and they could potentially be getting people sick. We saw a lot of cases where the governments of the world, including the United States, released people from quarantine after 14 days, and subsequently we have seen the start of clusters in those areas. Could they have existed independently? Absolutely. Could they have existed because of failures to handle the quarantine properly? Yes, I'm sure they did, considering the failures we documented. Could they also be coming from the fact that people get released into the community, and they may very well be on the road to recovery, but they are getting others sick? I think we have to consider that. I equally think that we have to, look, as this article says, at the question of how long we continue treatments for. And as we're talking about this in light of an ongoing medical shortage, that's a problem. We reported last week on a story from, it was a man from China who had tested negative twice for the coronavirus. And what he ended up doing was 4 days later, he ended up having to go, he ended up having to go to the hospital because he felt sick, and he ended up dying. And we reported that as sort of a false negative, and I think that's a big part of it. But the question is, are we treating these cases long enough? Do we understand any internal damage that's happening in all the mechanisms of this virus? I think those are important questions. And I understand, given the quantity of cases and the speed with which they're coming, long-term triage is going to have to give way, or long-term care, put it that way, is going to have to give way to short-term triage because of a limit in medical personnel. But in terms of our own expectations, I think that question is really important. So we're going to go from here to an editor, or I should say a sort of a summation of what's happening around the world. This is from the University of Minnesota, the Center for Infectious Disease Research and Policy. It's very well respected, very highly thought of institution for this, and this is going to talk about some risk assessment about what we're going to face. And I'm going to warn you, this is not going to be a very optimistic projection, but it does further substantiate what we've been talking about for some time on this show, and some of the problems that are out there with the hospital response, and why it's so important that we begin acting now with social distancing to not get sick, and as you as individuals listening to this podcast, take optimal protection for your families, loved ones, and the people who will listen to you without blaming you, right? So, ECDC, COVID-19 not containable, set to overwhelm hospitals. This is from Lisa Schnurring, the news editor. In a stark and urgent COVID-19 risk assessment update today, the European Center for Disease Control and Prevention said that in a few weeks or even days, other countries in the region may face huge surges that mirror those of China and Italy. It advised countries to quickly shift to mitigation strategies to protect vulnerable people and prevent overwhelmed hospitals. Reports of dire conditions in hospitals in Italy's hotspots have been circulating on social media for the past few weeks and are now appearing in medical journal and media reports. The ECDC acknowledges that high numbers of patients needing ventilation have exceeded intensive care unit capacity in some healthcare facilities in northern Italy. So I guess we got it right again. Good job. Let's see. In a Lancet report today, 2 authors from Italy said the percentage of COVID-19 patients needing ICU treatments has ranged from 9 to 11%, and that the ICUs will be at maximum capacity if that trend continues in one more week. They predicted that Italy will need 4,000 more ICU beds over the next month, a challenge given that the country has about 5,200 ICU beds. So they're saying there they needed to double. In the hard-hit Lombardy region, healthcare workers have been working around the clock. About 350 of them, or 20%, have been infected, and some have died, according to the report. Italy's government is considering hiring 20,000 more medical workers and providing 5,000 more ventilators. Unless the measures are implemented in the next few days, they wrote, otherwise avoidable deaths will occur. Intensive care specialists are already considering denying life-saving care to the sickest and giving priority to the patients most likely to survive when deciding who to provide ventilation to, they wrote. In the near future, they will have no choice. They will have to follow the same rules that healthcare workers are left with in conflict and disaster zones. And we already know that's happening because we've reported on at least 2 cases from Italy where doctors were sharing that terrible choice they have to make. And that's going to be the reality of this. The longer you wait, the more times that's going to happen. So it's really sad, but it's true. Countries on track for WHO scenarios, ECDC warns. In its assessment today, the ECDC said the risk of severe disease is moderate for the general population, but high for older people and with those with underlying medical conditions. Increased community transmission may exceed health system capacity in the coming weeks, it said, and countries should act now to step up hospital infection control and surge capacity. The ECDC said estimates for hospital care suggest that most European countries could reach Hubei province scenarios by the end of March, with all countries reaching that point by mid-April. The group urged member countries to implement social distancing measures such as canceling mass gatherings and cordoning off hotspots early to slow outbreaks and give health systems more time to prepare for an influx of patients. If I remember right, I think New York has actually put these in place too now, where you can't have more than 500 people at a gathering. The ECDC also recommended that countries designate COVID facilities to minimize the transmission to other patients and conserve personal protective equipment, and identify facilities for managing those with milder symptoms. That's like the drive-through option that you're seeing from South Korea, or you see sometimes triage tents put in place as a way to do that. When resources are stretched or limited, the ECDC said countries should take rational approaches to conserve testing, contact tracing, PPE use, and hospitalization for high-yield situations. So, what they're saying is you have limited supplies and you're going to have to make choices. And right now, everyone's fighting over where are the tests. We're past the point, kind of, where tests have to be the main priority. I'm not saying don't do it, but if we're making it all about the tests, we're reacting to the decision we should have made a month ago and trying to go back and fix something instead of dealing with the situation our inaction created. And I've noticed that really poor feedback loop has been the heart of why the Western response has always been a step behind. You can't, it's like saying that I wish I wouldn't put my arm in the thing to get my arm broken. Saying, well, I just won't put my arm in things anymore. You have to now deal with the fact that this has been amputated, it's been hurt, and that's what we're not doing. And you have to anticipate, okay, is the sickness going to go up my arm and get me sick? Am I going to take the actions I need to prevent that, or am I going to try to prevent the mistake I've already made? And the problem is our policy agenda, policy makers do not have the capacity mentally for understanding how to act to suspend this disease. And it's not an intellectual thing. I'm not saying they're not smart enough. I'm saying that they don't have the framework. When you fight a war, you win a war by winning it in your head before you end up going forward. And they don't have an idea of the end goal of this has to be to stop the virus, right? You win the war, and you work backwards from what you want to achieve. They are working forwards with the sequence of events instead of working backwards from the goal they need to do. And if you can do that, and this is useful for you as the listeners out there, if you know what you want to achieve, and presumably your goal should be that you want to keep yourself safe, you want to survive this, and you want as many people around you to survive it, then it's real easy to prioritize what you want to do. You don't panic, you focus on the things you must do, you take advantage of the things you can do, and you avoid those things you must not do. And whatever you have to do, it's obvious. I've got a friend actually who's literally driving across the country to get away from an area he doesn't want to be in, because that is the sort of thinking he thought was necessary for his long-term survival and his own threat assessment. It sounds crazy to people who think about this from the perspective of day-to-day living, but if you're honest about the scale and severity of the threat, that way of thinking may apply to you. But we aren't seeing that, so we need to do this differently, and social distancing is the lowest possible thing we can do to begin reducing the transmission rate, which is what all of the experts are saying universally across the board. Yet we don't see this happening yet in a major way. And we will get there, probably to the middle of the end of next week. They're going to have to start putting in quarantines. But are people ready for that? Are they planning for that? They're not even talking about that. They're talking about how they're going to, reduce the payroll tax, or that we're going to increase the food stamp program. I mean, these are sands in a desert. These are little granules of sand. We need much bigger responses. So anyway, Italy's health ministry today reported 2,651 new cases and 189 more deaths, raising its respective totals to 15,113 and 1,016 deaths. Spain's total rose to 3,126, with the addition of 782 more. France's total rose to 2,876, with 595 more. The United Kingdom reported 134 new cases, bringing its total to 590. Several European countries announced more steps to curb the spread of the virus. For example, Slovakia declared a state of emergency and shut schools and major airports, and the Netherlands banned events of more than 100 people and urged citizens to work from home if possible. I'm just telling you, for people ask me what to expect to see almost all the schools shut down nationwide by the end of next week, and I would say, realistically, the school year is probably over in most places, given our response in the United States, in Europe, and in countries that are hard hit. Other countries may be further behind. Canada might be a little behind on that. But I think that's where it's going to have to go, because kids are the super spreaders. I mean, every school is a huge batch of asymptomatic people, where if one person gets sick in there, that's going to happen. So just be aware of that and plan for that, by the way. Iran surge continues. A country requests IMF support. Iran, the third worst hit country, today reported 1,075 cases and 75 more deaths, raising its respective totals to 10,075 and 429. The country today asked the International Monetary Fund for $5 billion in emergency fund to help it battle COVID, its first such request since 1962. It's actually really interesting because Iran really works hard to exist outside of the international banking system, and I only mention it here as a takeaway because in the geopolitical discussion that you have to consider beyond this, it really shows how people are being forced into working together in ways that they would not naturally, and there's opportunities and dangers in that that we're going to have to keep an eye on going forward. All right, in a related development, the WHO today said a 5-day expert mission with its partners, including the Robert Koch Institute, that's the German CDC basically, and China, wrapped up work earlier this week. In a press release, the WHO said the group found that the country is moving in the right direction, with its response taking a comprehensive approach with case management, labs, and risk communication as the strong points. Well, I'm sure people in the West are going to be glad to hear about how great China has it. That'll make this work better, right? However, WHO officials said more work is needed in several priority areas, including epidemiological data collection and analysis, which is key to understanding how the outbreak is evolving and what control measures are needed. Also, the group said more efforts are needed to protect healthcare workers. And we have a report from Asia here at the bottom of this. South Korea today reported 114 new cases with 6 more deaths, raising its overall respective totals to 7,869 and 66. According to the Korea Center for Disease Control, it said all 80% of all cases are linked to clusters, including 99 illnesses recently linked to an insurance company call center in Seoul. Other developments in Asia. Japan today reported 55 more cases, 6 of them listed as asymptomatic carriers from 11 prefectures. According to the country's health ministry, its overall total is 602, plus 72 asymptomatic carriers. So some countries don't count the asymptomatic carriers as cases to keep the case count down, but it's interesting that they're finding them, because that's how you got to really do your contact tracing. So Japan must be out there and looking. Singapore today reported 9 more cases, 3 linked to a dinner function, 5 imported, and 1 under investigation, raising the total to 187, the health ministry said in an update. In a separate statement, the country's Islamic Religious Council announced the temporary closure of mosques after 90 citizens attended a mass event in Kuala Lumpur, where several tested positive for COVID-19. That's Malaysia. I don't know why they combined those. China today reported 15 new cases, 8 from Hubei province, as well as 11 more deaths, raising its overall total to 80,793, which includes 3,169 deaths, according to the country's National Health Commission. Okay. So let's see here. I'm going to give you a piece. There was one in the New York Times, but I'm going to give you this piece from Vox News. Alex Ward wrote this, and it was around 4:51 p.m. I want to tell you how bad it might be getting in Iran, and to give you a feel beyond the numbers what we are actually seeing. So, Iran's growing coronavirus in 3 stunning photos. The new large burial trenches are visible from space, and I recommend you look at this article. We'll have the article up both on Coronavirus Cast at Twitter, after this is posted, as well as in the links at Coronavirus Central and in the YouTube links. Okay, so new satellite photos show the coronavirus in Iran is much likely worse than its government is letting on, or at least that the country's leaders are preparing for the worst. The pictures taken on March 1st by the private space technology company Maxar Technologies were first reported by the New York Times. The images show 2 large burial trenches recently dug at a cemetery outside Qom, Iran's religious capital. The reason for the roughly 100 yards of new burial space is macabre. The country is going through a deadly outbreak of the disease that may only be growing larger. Iran has about 10,000 confirmed cases of coronavirus as of March 12th, but there are suspicions there may be many more. And in fact, I will say, we had a correspondent reporting to this podcast from Iran 2 weeks ago saying that they were losing the medical personnel at some of the hospitals to trace this, and the ability and staff to keep track of what was happening from a major hospital in the Tehran area. So we know, and there have been multiple people, Dr. John Campbell, many others, reporting that this has just been tragic on the ground there, and that the health system was overrun, and that now we are dealing with the consequences of that failure. And so let's hope this isn't a prediction for what we might see in the West, but it's something you need to know. Okay, a Maxar analysis told me the trenches were made very quickly and differed from previous ways Iranians have dug plots at this site. What's more, there's even an image showing a big pile of lime, which Iranian health officials had previously said was being used to bury those killed by coronavirus, which means these trenches were likely made in haste to deal with a growing body count. A count the regime, which includes many top officials also ill with the disease, is struggling to curb. Now remember, we are seeing huge burial mounds in Iran. We saw in Wuhan they brought in portable incinerators. They brought in, I saw the article, 40 portable incinerators, and we had evidence as early as, actually started in January, but definitely by early February, that there were reports coming out that they basically had the crematoriums running nonstop, well beyond capacity, and that they were getting more bodies than they could handle. And so, what's actually happening on the ground, now we're starting to learn. But the idea of there was always this stage-managed narrative to prevent panic, when in fact we should have been using the indicators to go ahead and prepare a solid policy response. And I can only assume and hope, the intelligence agencies of our various Western countries, and other countries for that matter, had better information than the public was given, and they began, acting. They have satellites. They could have figured out what was happening on the ground. I mean, it's pretty bad if 4chan's doing a better job than the CIA, but honestly, during some times of this case, it's actually felt like that, where, for whatever reason, we've seen a really delayed response from the different governments. But anyway, so Iran tried, and they've had a lot of problems. Let's continue. It's getting really bad in Iran, and Qom especially. Last week, CNN reported that dozens of dead Iranians were laid in black body bags on the floor of a Qom morgue. It's unclear how many of those people were killed by the virus, if any, but it underscored how the city, a place considered holy in Shia Islam and a major center of Shia Islamic learning, is struggling to contend with a major crisis. 2 medical workers in Qom told CNN that worries over the coronavirus had led to a stop in traditional Islamic burials, which include washing the body with soap and water before laying it to rest. Instead, those bodies are being treated with calcium oxide, lime, so they don't infect the soil with the virus. Ali Ramazani, let me just say that's really weird why they're worried about the soil getting infected. I haven't heard anything about that before. I mean, other than the fact that maybe they'll think it'll find root in some bacteria. Keep that in mind. That's a really curious data point, that in theory it shouldn't be something that they are worried about, because you would think it's all zoonotic expression. And I'm wondering if it's just an abundance of caution, or if there's something there, because we've seen little hints and pieces, I haven't reported on it publicly, about this idea that these may be able to hitch a ride in certain bacteria. I know they were doing some studies in Hong Kong. I'm going to make a note to look for some information on that, because that might potentially be an additional disease spread factor we're not even considering. And that's possible. I mean, we don't know what we don't know, right? Ali Ramazani, the director of the Behesht Masurme morgue in Qom, told state-run television at the time there was now a pile-up of the bodies at the facility as they await testing. It's unclear if the regime will get a handle on the crisis of any time soon. In the meantime, Qom is aware of what's at stake. And, people are panicking. I see these videos, they're terrible. They go lick the shrines to show they're not afraid. But if you don't have a medical system, you don't have hospitals, you don't have what you need, people don't have a lot of choices. And, it's easy to make fun of these things, right? And I certainly don't approve of the idea virologically. But, I don't know. Desperation makes people do strange things, doesn't it? Let's hope we don't get to that point. Make sure you prepare. Even if you're listening now, if you're just tuning in and wondering, where was I for the last 4 weeks? You're not too late to make a difference in your own life. Separate yourself, get what you need to be safe, and ride it out. You sit here with me. We'll be here talking about it together. You don't want to be in this mess. We got a case here. I'm going to report to you from the New York Post. And this is about New Jersey patient James Kai recovering from the coronavirus. People have had a lot of interest, like I said earlier, about understanding what this is actually like, what they experience, how they survive. And I want to share this with you so that you have some idea of what one person experienced who is a survivor and what he has gone through and how he was able to make it through, because I think there's actually some hope here in terms of, how a hospital system that behaves well is the difference between life and death, and that we want to provide that support both in terms of information and key equipment to our medical providers, who are really the heroes of this crisis. Okay, so this is by Jackie Salo, and it's from 9:47 a.m. yesterday. New Jersey patient James Kai recovering from coronavirus. The New Jersey healthcare worker who was the state's first coronavirus case says he's on the mend, adding that he would be, quote, dead and gone had he not reached out to doctors in China about how to defeat the deadly bug. James Kai, a 32-year-old physician's assistant, remains hospitalized Thursday at Hackensack University Medical Center, where he's now only experiencing a cough and fatigue after 11 days of battling the virus. Fortunately, I have resources and knowledge about it, or I would be dead and gone already, Kai told the Post in a text message. He credited several Chinese doctors with helping his providers here better understand the infectious disease taking over his body. Quote, most medical providers here don't know about it. They need to communicate with Chinese medical teams. Kai said he believes that he came down with the bug while at the Westin in Times Square for a medical conference from February 28th to March 2nd. During the final days of the conference, he started to experience bone pain, which was followed by a cough. He then went to a local health clinic where they determined that his heart rate was fast, he was said. Kai was instructed to go to the hospital where CT scans had shown he had lost 50% of his lung function. Doctors started to treat him like he had bacterial pneumonia, but his family was unconvinced and reached out to 5 Chinese doctors who studied the virus that emerged in Wuhan. It was only with the Chinese experts' encouragement that they agreed to perform a coronavirus test, he said. When it came back positive, they recommended he be treated with the anti-malarial medicine chloroquine and the HIV drug Kaletra. Chinese experts suggest to treat with the medicine to slow the virus first. Don't wait, he said. Definitely I would not be here without them. Kai said since he was otherwise healthy, he fears how those who are older will fare fighting the virus. I am young. People who are 40 years old and above definitely will not be making it, Kai said. His case is among the 23 people infected with the virus in New Jersey, where Monday a state of emergency was declared. So, interesting, like we were saying, chloroquine is proving something that can mitigate the worst of this, but here's the catch-22. You have to be tested, you have to know you have it, and you have to begin administering it. And if the U.S. isn't able to put test kits, I think we would almost be better served to ramp up production of chloroquine, get that to people, and you know what? Take it as on a voluntary basis as a preventative course when people have a flu symptom that reaches a certain level of severity to prevent this from going there. That alone could potentially save many millions of lives. We aren't even talking about that in our policy response. And, I would note, as we're talking about Mr. Kai's case here, that, he's 32 years old, relatively healthy person. He goes to an event that's probably a super spreader event. Are they case tracing that event at the Westin in Times Square? Are they quarantining all the medical workers who weren't protected from him spreading it? These are the questions that we need to be asking. And that he had testing doctors who didn't want to test him for this, following inadequate CDC protocols, a lack of testing, and a general lack of awareness about what this case portends. And as we have these early cases coming into our medical system, okay, that have this, that are being misidentified and for which there are no protective measures in place, how many medical workers are going to get sick at the beginning of this virus, and they're going to have to self-care for themselves at the same time that people are out there? That's what happened in Wuhan. That's how the hospitals got overrun. And in China, what they did was they had a national health emergency where they basically took doctors from everywhere else around the country and started shuffling them into Wuhan. But we have an issue in Seattle. We have an issue in New York. We have issues in San Francisco, Los Angeles, I believe Houston. We have an issue in Boston we're going to talk about. All of these places, D.C. How are you going to shuffle the doctors around? You can't do it. And even if you wanted to, it's not like, China, where you can just move people between departments. You have healthcare systems and procedures and laws and all this stuff in the way. So what we're dealing with is a lack of coordinated response. But what we also have seen is that people can and do survive this, and that it can happen quickly. And I don't know, Mr. Kai, why he at that age, if he had a comorbidity, if he had a high expression of ACE2 receptors. I don't have a lot of details about the case study of it. But I do know that it's something that we need to be very well prepared for, and that this is going to be an ongoing thing where if we don't have a good treatment protocol in place. And I want to thank the doctors and medical researchers who are part of our open source intelligence network. If I know these things, yes, I do my own research, but I want to give credit to them because they're the ones who really do the hard legwork and who help me convert science to English. I was just a little in front of it, but it's a team effort because all we're looking for is survival. Okay, so let's go to the next one here. This is from the Times of India. We haven't talked that much about India. They're reporting up around 70 cases, and presumably they're doing some pretty aggressive contact tracing. I hope they don't have it really badly, but India does have healthcare problems. So we're going to look at what they've been able to do in terms of a treatment protocol that has some similarities to things we've talked about, some differences, but it will look familiar to you and it offers another option. And I think it's important that we have multiple options for treatment because, frankly, we're probably not going to have enough drugs to do everything the same way. Different systems have different supplies, and with the passage of time, unless we see the massive ramping up of operations, you're going to have a hard time treating this. And I will say one other thing. I had a great question earlier today. People asked me if you could use quinine in lieu of chloroquine, and I would think, although it might be slightly less effective, that it would help. And that's something that I know some people have found the ability to get. So if you wanted to add an additional source of protection, potential treatment to your own treatment protocols, you might want to take a look at that. Like I said, I am not legally permitted to give you medical advice. Nonetheless, other countries are thinking this way, and I will let you decide what weight you want to give to that sort of thinking here. You're not going to get CNN telling you that, I tell you. Okay, so Rajasthan doctors cure coronavirus patient with HIV drugs, and this is from the Times of India News from 8:27 India Standard Time. I guess that is March 12th, and I just don't know what time that is over here, but yesterday. Okay, Jaipur. Sawai Man Singh Hospital doctors have successfully treated an Italian coronavirus patient using a combination of HIV, swine flu, and malaria drugs. The patient, who has now tested positive for COVID-19, had come to India along with her husband as part of a 23-member Italian group that had traveled major tourist destinations in Rajasthan. Her husband was the first in the group to be diagnosed with the disease. The National Institute of Virology in Pune had confirmed him as a COVID-19 case on March 3rd. The next day, his wife also tested positive. SMS doctors first treated her with a combination of two drugs useful in HIV treatment. We gave her a combination of lopinavir 200 milligrams, ritonavir 50 milligrams twice a day, said Rohit Kumar Singh, additional chief secretary for the health department. Singh said ICMR was satisfied with the protocol of having two HIV drugs, which the SMS hospital relied upon. Besides, the doctors also gave her oseltamivir, useful in swine flu treatment, and chloroquine, useful in the treatment of malaria. SMS Medical College Principal Controller Dr. Sudhir Bhandari said, "We provided her with treatment following standard protocol, and now she has tested negative for the disease, which is a major achievement for SMS hospital doctors." Her 69-year-old husband is still undergoing treatment for COVID-19 at the hospital. A day ago, his COVID-19 test was done, but he still tested positive. Doctors are providing him treatment and non-invasive ventilator support. Since his wife has now tested negative for the disease, we offered to shift her from the isolation ward. She, however, has decided to stay with her husband in the same ward, said Dr. D.S. Meena, medical superintendent at SMS Hospital. Her husband is taking time in recovery as he is already having a lung disease, doctors said. However, his condition is stable, they added. So, once again, we see these anti-HIV, antiviral drugs in combination. And, even though it's for Ebola, remdesivir is in that same class. Any of those VIR-ending drugs kind of come together, although they're going to be, what the supplies are, is going to be the challenge there. And, it's a closely held secret that I know the FDA has been looking at. And I know the FDA... in this crisis, we've reported, has generally done a better job than some of the other agencies being in front of it. So hopefully they're working to solve these shortfalls, but we have that, and we have chloroquine that's out there, once again, as a treatment protocol. So something for the medical practitioners to continue. So now we're going to begin the transition into the second part of, I guess this is now a 3-part show. Here at 54 minutes, you're listening to Coronavirus Central. I am Tom Kaczynski, and we are working our way through the pandemic, trying to understand how to keep you safe and what is happening in the larger picture as well as the smaller one, as there are many things you have to navigate through. Do not panic, prepare. We will give you the best information before anyone else does. This is your own open source intelligence agency, and I am here helping you give your briefing for the war against the virus. So we're going to look now at some of the problems between the U.S.-China relationship. We're going to look at what's happening in China in a little more detail, and we're going to look at how the two countries are working with one another and how there is this strange, ugly, codependent relationship that we're going to have to deal with. And, the reality is China produces a lot of drugs, and if they are getting their economy online and they could be part of that solution, that's something as in need to treat the virus we need to work at, and the politics may very much intervene. If we reach a point where the citizens of the United States are experiencing a death toll that goes into the 5-6 figures and higher, and China is refusing for political reasons not to release medicines that could save potentially American lives, I guarantee you two things. Number one, our government will love to blame them for that, causing rapid, huge anger. And number two, the origins of that conflict will start here with decisions and rhetoric that are being put out there that are prioritizing competitive advantage between countries and between politicians seeking to mollify their own domestic populations, as opposed to really treating this virus seriously, and that puts everyone at risk of greater infection here in the United States in the outbreak, as well as in the Western world, as well as from China, who's going to have reinfection at their own rate because they're putting people back to work faster. They have to balance those things, I understand that, and their own economic needs because they have a highly export-driven economy in many ways, not just the United States, but around the world, because they've set themselves up that way. And, if this represents part of a larger economic collapse, then you're going to see different countries jockeying for position in, hate to use a catchphrase, in a new world order where the balancing is going to be very different. The dollar is no longer king, and we may have a very different world on the backside of this. Those are big projections that may or may not happen, but we need to start looking now because, the old joke is, not joke, but the old proverb is, a butterfly flaps his wings in the Sahara Desert and you end up with a hurricane in Florida. It's kind of true that you can see the first steps here of a problem that's probably going to become much bigger, and our job with this show is to begin anticipating this. And it starts with a problem that should be well understood at this point. The world allowed China to become its factory because we didn't want to deal with the environmental issues from one way of thinking at, and because we were able to get really cheap, basically slave labor, because we let that government treat those people that way. On the other side of it, and so now they are the ones who have the ability to have what we need to survive. And to understand economics, it's not a function of the Dow and these finance numbers. It's a function of scarcity and need. We need drugs, they have them. That's a power relationship and an inversion there. Where 2 months ago it looked like China was in huge trouble and we were the ones looking at them thinking they did this, and now we have their problems, except we don't have their capacity for solutions, or at least we're not enacting it. So this article is from the New York Times. It's from yesterday, from the 11th, I apologize, from Anna Swanson, and it's called Coronavirus Spurs U.S. Efforts to End China's Chokehold on Drugs. And there's a number of other countries that are doing this sort of strategic analysis, but we need to talk about this because this has key elements for both the political framework and our ability to treat this. We identified as one of our major 4 points of a health system collapse when we talked about that, the lack of drugs. So let's go into this. The Trump administration says the United States is too dependent on China for vital drugs, but it's unclear how much Washington can do to alter global supply chains. Washington. The global spread of the coronavirus is reigniting efforts by the Trump administration to encourage more American manufacturing of pharmaceuticals and reduce dependence on China for the drugs and medical products that fuel the federal healthcare system. The effort includes a push by the White House trade advisor Peter Navarro to tighten Buy American laws so federal agencies are required to purchase American-made pharmaceuticals and medical equipment according to people with the knowledge of the plans. And just to give you a little bit of background for this is that one of the reasons you have these Buy American laws is because we literally cannot compete on labor costs with other countries as well as with our stringent labor and environmental regulations. So when you want to have things in the United States built and you're going to have it be on a non-cost competitive basis, you can't compete with it. In fact, I'll tell you an example of it, right? It's a textile example, but I was looking to have a project done once, and I tried to do it in the United States, and it cost me $25 at the cheapest vendor I could find to do it. China could do it for $3. And the problem is, if you're trying to do something in an economy where people have limited means to spend, everyone went to China. And they did this because China basically said, okay, we're going to sink government money into industry, build these huge factories, or, subsidize businesses that we wanted to succeed as part of, sometimes they've called it state capitalism. They basically had the government directly subsidizing industry to the point where private industries in the U.S., Europe, and around the world could not compete in terms of cost. And there was a relationship between the big corporations who China used for intelligence and research and to develop their society and to advance, quickly, starting with Chairman Deng Xiaoping, really. And at the same time, but China also agreed and gained a strategic leverage as being the big producer. In the same way the U.S. does with their currency, that we use it as a weapon, China in the same way can do that with their manufacturing capacity, where if we need something, we have to do that. And you had seen before this whole coronavirus outbreak, if you had followed it, that China would sometimes dictate to the entertainment industry, right? Some of you may have seen the Winnie the Pooh South Park episodes, that where China would go ahead and use its leverage of both control of access to its market, which is one of the largest in the world, second largest, and also the fact that it has so much productive capacity. So that created certain problems, and we're seeing some of those problems manifest here in the fact that we don't produce our drugs, and that realistically, unless we want to pay a lot more under our current economic model, we are not viable to compete. And that's a big problem that this whole crisis is revealing, that the West's way of thinking of economics creates now an existential flaw in terms of our security against certain risks where we need to be able to have things directly produced. And frankly, a lot of people are going to die because of that oversight. But let's continue and hope that we can make that lower by going out there and solving the problem directly instead of saying, how do we use our system to solve it? We need to take that use the system part out of the equation and say, how do we solve this? But the administration, here's what they offer. The administration has been preparing an executive offer, which could be released in the coming days, that would close loopholes allowing the government to purchase pharmaceuticals, face masks, and ventilators and other products from other foreign countries. The hope is that increasing government demand for American-made drugs and medical products will provide an incentive for companies to make their products in the United States rather than China. And so I used to work as a purchasing officer for a major corporation. What they do is they will say designed in the USA or, imported. They find all these little clever ways, and there's a list of 100 different countries, right, you can theoretically import from, because the countries lobby the U.S. Congress. I think it's the most lobbied institution in the world, and it's crazy they can do this, but this is what happens in Washington. They spend a whole bunch of money, say, okay, well, we want to go ahead and we will support Washington's defense policy. You take our goods, and they say, okay, so the companies offshore, like they do this with refrigerators in Bangladesh, okay, just to give you an example of something that actually happens. And they do it, and they say, okay, well, Bangladesh is an ally country, so you can import that, same as if it was built in the USA. And the problem is, it saves a lot of money for the government, it saves a lot of money for all people involved, at the cost of not having American domestic production, which we've accepted because we have banks that go out there and say, okay, as long as we're consuming, it doesn't matter where the production's coming from because we're lifting all boats. But now we have a bunch of dams in the middle of the lake, if you know what I'm saying, and it's all drying up, right? But I'm just explaining this so you understand why this is important, because otherwise you won't see potentially the larger implication, which is that we need things and we can't get them, and that's at the heart of why people are going to get sick and have issues in this crisis. And it means what the solution needs to be. We need to be able to build things domestically. Whatever country you live in, it's a logical thing. Or community, You want to have the skills in your house to survive. This scales up and down. Self-sufficiency is a great value for everybody. To help facilitate such production, the White House is also pushing for streamlined regulatory approvals for American-made products and more detailed labeling of the origin of products made offshore, these people said. China has managed to dominate all aspects of the supply chain using the same unfair trade practices it has used to dominate other sectors. Cheap sweatshop labor, lax environmental regulations, and massive government subsidies. Mr. Navarro said in an interview. As President Trump has said, what we need to do is bring those jobs home so we can protect the public health and the economic and national security of the country. And that's absolutely true, and it should be a nonpartisan issue. Everyone should want to have more jobs and better paying jobs in the United States of America or your home country. Because it's a way to peace, because then countries can't leverage one another and basically blackmail them into doing things they don't want to do. China is known as the world's factory for car parts, toys, and electronics, but it also churns out much of the penicillin, antibiotics, and pain medicines used across the globe, as well as surgical masks and medical devices. While the United States remains a global leader in drug discovery, much of the manufacturing has moved offshore. The last American plant to make key ingredients for penicillin announced it would close its doors in 2004. Chinese pharmaceutical companies have supplied more than 90% of U.S. antibiotics, vitamin C, ibuprofen, and hydrocortisone, as well as 70% of acetaminophen and 40 to 45% of heparin in recent years, according to Yan Zhonghuang, a senior fellow for global health at the Council on Foreign Relations. Supporters of reducing reliance on China have used the coronavirus epidemic to highlight what they say is a long-standing vulnerability that could leave Americans dangerously short of medicines in the event of a war, trade conflict, or pandemic. If China shut the door on exports of core components to make our medicines, within months our pharmacy shelves would become bare and our healthcare system would cease to function, said Rosemary Gibson, a senior advisor with the Hastings Center and an author of China RX, exposing the risks of America's dependence on China for medicine. In the event of a natural disaster or global pandemic, then the United States will wait in line with every other country for essential medicines. And you know what? China's going to make new friends. You can expect this. And they're going to go ahead and figure who they can pull into their orbit, because that's what countries do. So we have this problem. And I will say, keep this in mind. So one thing they're not saying is those supply chains already started to run out in mid-January when shipping stopped out of China. And it was really heavily by February. So we're not talking about this just happening now. We are now 45 days into a supply disruption of a supply system that's designed to go no more than 90 days in most scenarios. So as we come into April and the crisis hits and the massive demand surge comes up, it's easy to predict that the problem of supply is going to be huge. And I hope we can find alternate ways around that through India or whatnot. But even if you did have sources, getting the goods in and out, what are you going to do? I mean, you could maybe do some things by air freight, but you would have a lot of problems moving that level of goods. And hopefully people in Washington are anticipating these problems and coming up with solutions rather than just thinking that you can throw money at a problem. I mean, our whole economic basis of thinking that economics is money is just wrong. Economics is scarcity and need, and that's what it is. In the event of a national disaster, some in China have also noted these vulnerabilities. An article posted last week by the state news agency Xinhua argued that the world should thank China rather than blame it for spreading the virus, said that if China banned the export of drugs, quote, the United States would sink into the hell of a novel coronavirus epidemic. China does not appear to be explicitly blocking the export of pharmaceuticals, though it has cut off exports of face masks by requiring the manufacturers to sell straight to the government for distribution, leaving none to send overseas. So functionally, you're not getting face masks, and I don't know if you're getting drugs or not, but I'm not hearing about them coming in. But we'll see. No one is saying this. Let's see. Factory closings and transportation restrictions in China have disrupted supply chains for drugs as well. Public health officials are watching to see whether the coronavirus epidemic will lead to more shortages of essential drugs in the U.S. in coming weeks. I would bet a lot of money on that happening, even in the best scenario if everyone's playing nice. And I don't think it's going to be the best scenario. On February 28th, the Food and Drug Administration warned that one drug was already in short supply in the United States because of manufacturing issues and said it was actively monitoring about 20 others that rely on China. Last week, the Indian government, that's our second biggest place we import for pharmaceuticals from for our American audience, and it's basically the place for the world too, ordered its pharmaceutical companies to stop exporting 26 drug ingredients, most of them antibiotics. South Korea, Germany, India, and Taiwan and others have clamped down on exports of masks and other protective gear over worries that their own supplies will fall short. The coronavirus shows the importance of bringing all that manufacturing back to America, and we will have that started. President Trump said in a meeting last week at the White House with the chiefs of major pharmaceutical and biotech companies, it's already started. Frankly, it started about a year ago. Mr. Trump's lunch meeting with Senate Republicans on Tuesday, Senator Marco Rubio of Florida, urged lawmakers to move quickly to leverage government programs like Small Business Administration loans to ramp up American production. Mr. Trump agreed with the plan, according to a representative from Mr. Rubio. The coronavirus outbreak has made clear we must combat America's supply chain vulnerabilities and a dependence on China in critical sectors of our economy. Mr. Rubio said in a statement he called the administrative's coming executive order a very strong first step in incentivizing domestic production. But there are big questions about how much the government can influence the behavior of private companies and reconfigure a global supply chain that is heavily invested in Chinese manufacturing. If we want to reduce dependence, there's no easy fix to the problem, said Mr. Huang of Council on Foreign Relations. Quote, technically, I think it's possible, but unlikely from a cost-effectiveness perspective. What do we say again and again on this show? If you choose between economy and health and you pick economy, you're not going to have economy or health. So what you could do, and this is very simple, as the government does what it did in World War II, a war which we declared against an enemy. We went ahead and we said, we are going to require you to build these things in your factories. We will subsidize it, and we will not permit you to do otherwise, right? And we're going to give you money. Rather than giving you money to the stock market, we're dumping $1.5 trillion so that the numbers look good on the screen. We could instead be dumping $1.5 trillion into massive manufacturing retooling, where we tell Pfizer, GlaxoSmithKline, all these companies that have the technical expertise we need, you are going to build this factory, we are going to pay for it, put the damn pills out there. Here it is, chloroquine, remdesivir, all the things we've been talking about, that you could do this, but you don't do it because we're counting and we're having conversations about what we'd like to do instead of doing something. This is the root of the failure, that we do not treat this as seriously as we should. And you see it over and over again, on both sides, on all sides, really. I mean, we just aren't thinking of this problem. The Trump administration has urged companies making electronics, steel, toys, and many other products to move their supply chains out of China with mixed success. Some companies have left China in response to tariffs Mr. Trump placed on more than $360 billion of Chinese goods, but many have moved to other low-cost countries like Vietnam, India, and Mexico, rather than returning to the United States, and many products that are made in the U.S. still contain Chinese components. And that's that API thing that we've been talking about, that really like 80% of the chemicals goes in, and no one wants to make chemicals because it's a nasty, ugly process. China accepted those trade-offs because they wanted to have economic growth. We rejected those because we wanted to have environmental cleanliness. Well, we have that except for this virus, right? So, I mean, these are the trade-offs that were made, and I'm not saying that they were unfair choices, but this is what happened. Critics of China's dominance of global pharmaceuticals say Beijing has used the same strategies it has used to gain a foothold in drug making that it has in other industries, including generous government subsidy and lax environmental rules. China is also a key producer of chemicals that go into making drugs and home to a vast supply of well-educated but low-paid scientists. And pharmaceutical companies say they're drawn to China as a large and rapidly growing healthcare market in its own right. David Goff, the Senior Vice President at the Association for Accessible Medicines, which represents the generics industry, said the globalization of the supply chain was a market reality for all types of drug makers, and the United States had one of the world's safest drug supply chains. I don't know if that's true, but we'll find out. The Food and Drug Administration does not gather precise figures on the volume of drugs made overseas, only the number of facilities making them. According to that data, 72% of the manufacturing facilities making active pharmaceutical ingredients for American drugs were overseas, with 13% in China. But Michael R. Wessel of the U.S.-China Economic and Security Review Commission said those numbers understated the American reliance on China, which has some of the world's largest factories. And when the U.S. imports finished drugs from European and India, those often contain Chinese components as well. The coronavirus crisis puts into sharp focus the unacceptable dependence of the U.S. on China for critical medicines and their ingredients, Dr. Wessel said. Mr. Wessel, I apologize. The federal government maintains a strategic stockpile of drugs and medical supplies, but those could fall short in a pandemic, and we don't know how big that is. I've been trying to find out, and if you know, man, tell me, and I'll put it out there. Okay. In the private sector, as in many other industries, pharmaceutical companies have shifted from stockpiling goods in warehouses to a, quote, just-in-time logistics model that ships products as need arises, reducing costs but also increasing the likelihood of shortages. So we don't keep a backup supply. What we do is we just get exactly what we need, which is more efficient in some ways, right? It's like when you're running, your body's more efficient, but you're using a lot more resources, and you need a constant flow of resources. Right now, we don't have that, and that's why that supply chain, that pain you feel when you're running, that lactic acid, that thing's going to blow up quick. That's going to be the lack of drugs. The question is whether the government has enough levers to encourage more private companies to rework their supply chains or encourage new manufacturing startups in the United States. No, that's not the question. I mean, I understand that's the question the government's asking. The question they should be asking is, how can you build this quickly? What do we have to do to make it happen? Those are the questions. You see the problem. Reactive, letting people make decisions, versus active, solving the problem, because we just don't take COVID seriously. And we'll be talking about this a month from now, that they'll be reacting with quarantines to what we told them a month ago. Everyone who's listened to this show we're on episode 29, this is utterly predictable, and it's really the root of the problem. The virus is exposing a problem in how we think about things, and I hope people are learning that as individuals, and it's the key to your survival from moment one. It's why I was in front of this. It's not because I'm a genius. I mean, it's because I can see these things, because it's a pattern. It's easy to identify once you know what it is. Okay, American officials say Buy American laws, which require the federal government to purchase American-made products where it can, offer one powerful lever. The government buys vast amounts of drugs and medical equipment through the DoD, Health and Human Services, and Veteran Affairs. A series of waivers and trade agreements allow those agencies to purchase products from foreign countries, with the decisions often based on price. Mr. Navarro is examining agreements struck by the DoD as well as the World Trade Organization's government procurement agreement, which allows the government to purchase drugs from dozens of countries around the world, according to people with knowledge of this initiative. Where American-made drugs are not available, the government will still be able to buy foreign drugs, but over time the administration expects the policy will encourage manufacturers to invest more in the U.S. If we have strong Buy American procurement, that will establish a robust base level of demand that provides the appropriate incentives for pharmaceutical manufacturers to invest and locate domestically, Mr. Navarro said. He added the United States also needed to invest in advanced manufacturing technologies to aid drug production. The government has funded research in recent years into new types of manufacturing systems that are smaller scale and more flexible operations than operations run in China. And I want to say, it should be obvious to people listening, especially the people around the world who say this. America has one very unique problem. We treat healthcare as a market force, whereas every other country around the world pretty much treats it as service. We're worried about how to make this financially viable. Whereas other countries treat their health service a lot like we treat our military, where we don't ask what the cost-benefit analysis is of a soldier's life-earning capacity versus their willingness to go out there and sacrifice their lives in combat. We instead talk about, values that are qualitative, like patriotism and whatnot, although those are often manipulated, unfortunately, to deal with this. And a lot of countries approach health that way, because if you treat health as an economic equation, you can't ever solve it. You have unlimited demand to meet limited supply. And the way you kind of get around those problems, even though it's imperfect, is to say, hey, this is a national priority, we're going to invest in it. And I think one thing that's absolutely going to come out of this crisis in America, or whatever follows it, is an understanding that we can't continue to treat healthcare as a market force. Yes, it is true that market forces create higher innovation, and there's certainly room for hybridization. But on the other hand, right now we have a cure that, not a cure, but a curative agent in chloroquine that is cheap, mass producible, that we're not looking at because no one makes money from something that isn't on a patent. And it's disgusting, and that's the problem over and over again. And it's just a lack of vision, a lack of loyalty, a lack of concern that's really been at the heart of this. Delayed, depressed American response, and that we're unfortunately all going to be victims of. And hopefully, we get some people thinking differently about the actual problems and recalibrate quickly. It's not like we don't have the resources, we just don't have the will and mindset. Let's see. The government has funded research in recent years into new types of manufacturing systems that are smaller scale and more flexible than operations run in China. The FDA has said these types of operations, which can potentially be reconfigured to produce different types of pharmaceuticals in times of need, could enable American-based manufacturing to regain competitiveness in with China and potentially ensure a stable supply of drugs. But expanding beyond a few trial manufacturing projects in the United States could be hard. Supporters say these projects need more funding and a specialized approval agency approval process. Sorry, I flubbed that sentence. A specialized approval process with the agency. So, no, we don't need a test approval. We need to go have a field test. What do you guys think? Do you support that? Build pharmaceutical factories to make drugs now? Is that a good plan? Let's do that. Democrats, Republicans, we can all support that. Create some jobs, right? The issue has attracted the attention of some lawmakers. Mr. Rubio has introduced a bill that would require the drug makers to report to the FDA the source of active ingredients in their pharmaceuticals, as well as tighten Buy American laws for the Veterans Affairs Department. Good. Senator Josh Hawley, Republican of Missouri, has introduced separate legislation to give the FDA expanded authority to request sourcing for information from drug and device manufacturers. And Representative Anna G. Eshoo, Democrat of California, has set up a bipartisan working group to examine funding and incentives for domestic drug production and introduce legislation to strengthen reporting requirements around drug shortages. Okay, so good things, yes, but not enough, right? So they're all talking about, well, we know we have a problem. Let's talk about what happened so it doesn't happen again. No, fix the damn problem, right? But the problem is now we're reliant on China. And the reality of this is, and this is the ugly part, if we don't get those drugs from China, if we don't get some of those masks from China, this is going to be worse than we would. And China is going to have every country in the world, right, pretty much asking them for help when this happens. All those countries in Europe that it probably has better relations with in a lot of ways than the United States. And what you are going to see as a result of this is a reconfiguration of the geopolitics. Some of you know about something called the Silk Road Initiative or the Belt and Road Initiative, and this idea that China was trying to get around its economic problem of needing more energy production, where the U.S. has a lot of influence in the Middle East and in OPEC, as well as with the petrodollar, and build new relationships. What you are going to see is alliances are going to collapse, reform, move around. You know, we saw this before World War II, actually. Italy jumped sides. Originally, they were going to be on the Allied side, and then they jumped over to the Axis. You're going to see a lot of moves happen. Turkey's been getting close to Russia. All this geopolitics is based on economic scarcity and localized interest. Turkey might want a piece of Syria. Russia might want the Ukraine. China's been looking at Taiwan for a long time, and America has basically served as a stopgap to prevent a lot of things from happening. Expect to see crises follow in the wake of this, where America's vulnerable. Countries that have been looking at opportunities to expand influence in their area, including potential wars and annexations, become very possible. This is the subject of a world history. I am a historian, that's my background. The fact that we've had stable borders since essentially 1945, for the most part, has been very ahistorical in terms of its outputs, and now we are going to see some of those actions play out with respect to what this virus portends. That's a bigger issue. Let's go to a smaller issue, though, which is equally relevant in how this begins to shake out, which is how the U.S. and China are talking to one another about this. China's got a big problem. There's this great little thing here, and I'll put it on the link. It's by Jennifer Zhang, who's been reporting on this, doing a very good job from NTD News. And you can watch, this is from the Haishan district of Yingqing in Hubei province as of March 12th, and you see people screaming out their windows for the head of the Communist Party in that province to step down because they're so mad and angry about what's happened. And governments don't like when people are angry. What they do is they find other things to fight upon. You know, a cynical person might note that the divisions in the United States that existed after the highly contentious election of 2000, you remember hanging Chads, Florida, Bush v. Gore, were put aside for a while after the attack on 9/11, ended up in a series of wars that served for a time to provide a degree of national unity and to draw people past a point in the narrative they weren't comfortable with. So China has the same problem. Everyone's looking at the world. They don't want to deal with the Wu flu, the Wuhan virus, the China virus. Not saying these things to offend you, but the reality is that's what people talk about. I'm just telling you that a lot of people are going to look at this, and as the people get sick and die, and they want someone to blame, and the government's going to be out here, they're not going to say, well, we really screwed this up. What they're going to say is, China did this, they're to blame, look at them, because that's what politicians do, shift blame. When was the last time you saw a politician in any country say, yeah, this was our fault, we screwed up, like Harry Truman used to say, the buck stops here. The buck's running off in the woods, you know what I mean? So China is no different. All right, so this piece from Business Insider, this is by Ryan Pickerel. Chinese Foreign Ministry spokesman pushes, quote, coronavirus conspiracy theory that the U.S. Army brought the epidemic to Wuhan. And I'm sharing this with you because, I'm not going to tell you what the origin is because, frankly, I don't know. But what I do know is that two things matter here. Number one is what it is does matter because of how it means we should treat it. But number two, what people come to believe it means, what it is. And to this point, I've made the argument that people are saying that this is a natural disease largely because, one, scientists don't like to speculate things they don't know about, which is a reasonable position. And two, governments don't want to have someone be responsible for this up front because then that requires actions. This is an attack that's going to be responsible probably for killing a very substantial number of human beings, larger than most wars do, if it continues to spread unchecked at current rates. And as such, someone has to be held for account. Someone always has to hang. That's the nature of how we are as a species. China doesn't want to be it, so they have been working pretty actively for the last 2 weeks to present themselves as part of the help and cure because they want to be out there saying, we're going to provide goods, they want to restart their economy, and we don't want to be seen as the bad guy because they don't want to get blamed for this. Who wants a war? Nonetheless, here's what they're saying. No, they're taking a different position with respect to the U.S. And I will say, it's an interesting thing. I talked to people in the intel community as late as January, and they were saying they thought China was involved with this and, potentially because it could be a form of asymmetrical warfare. So I'm going to present a really crazy theory that someone gave me, and then you can decide if you think it's totally beyond belief or if you want to put something in it, and I am not endorsing it. I'm just sharing it because I want to get your mind thinking a little differently before we go into this. There was a theory that went something like this, that China or someone in China permitted this to escape because, as we've noted, this is a virus that kills off a lot of old people, and that China, because they are an authoritarian country, thought they would be able to manage even as it was exported. Remember, the day before the Wuhan quarantine, millions of people escaped Wuhan and traveled around the world, including, there was an interesting tweet about this, a great number of employees involved in leatherworking that ended up moving to northern Italy. And as you would know, Lombardy is in northern Italy, so that you literally had the scattering out of Wuhan you can potentially trace back to the spread of the Western virus. And though China was hurt and their economy has been heavily damaged, their export sector, fundamentally their manufacturing capacity remains intact, and now they're in a position where, when the old world order, the U.S. had a strategic advantage on oil, where the oil price we've seen has been utterly destroyed. In this new world that's developing, China now has the key thing, which is medicine and medical productive capacity, which countries will need in order to keep stability as their domestic governments go out there. At the same time, this virus, uniquely because of the West's dependence on individualism and our cultural differences, as a sign of cultural warfare, we are individualistic, pluralistic, whereas they are hierarchical and authoritarian. Our response was predictable in that we would poorly handle this crisis if we had a disease that did not rise above a certain level. And so the theory goes in this scenario that China gets the disease, that someone allows it to be released wittingly or unwittingly, and that they go ahead and see this as a form of asymmetrical warfare. There were apocryphal posts very early saying China won World War III before the first shot was out there. I'm not endorsing the theory. I'm simply saying that that's a theory that's out there, and you're going to hear it. So I'm telling you first and laying out the logic of it. It's twisty, but the idea is, in the land of the blind, the man with one eye is king. And that sort of strategy has a long historical background in Chinese history, where, frankly, they have dealt with situations where they've had 7- and 8-figure death tolls, like the Great Leap Forward in institutional memory. And we've seen that from other communist regimes throughout history. I don't don't want to make this ideological, but that has happened in various numbers of totalitarian regimes of left and right-wing stripes. So the idea that you put the national benefit above and you go ahead and you fight the war you can win versus another war is an idea that has some credence. And you go back and look at Senator Tom Cotton's statements, some other ones, there are people in Washington who will be very ready to believe that argument. Conversely, China basically has been making the argument, and we're going to cover it in this article, of the opposite, that this is something that was done to them, right? And that who are they going to blame? Well, they're going to blame the United States. Let's read this argument. A Chinese government spokesman said on Thursday that the U.S. Army might have brought the epidemic to Wuhan, appearing to push a popular conspiracy theory. Chinese officials have been trying to reshape the narrative about the coronavirus, suggesting it may have originated outside of China, even though the center of the outbreak was central Chinese city of Wuhan. Amid this push, a conspiracy theory that U.S. athletes participating in the military World Games in Wuhan last brought the coronavirus into China has emerged. There is no evidence supporting this claim. A Chinese government spokesman said on Thursday that the U.S. Army may have brought the epidemic to Wuhan, appearing to push a popular coronavirus theory in China. Zhao Lijian, a spokesman for the China Ministry of Foreign Affairs, called attention to a comment on Wednesday from Robert Redfield, director of the U.S. CDC, acknowledging that some Americans who were said to have died from influenza may have actually died from COVID-19. Didn't I tell you that? A month ago I told you that was going to be the case, that in fact that was what was probably happening. So, not that all of them did, but I knew it was hiding in the flu population. When did patient zero begin in the U.S.? How many people are infected, Zhao wrote on Twitter. What are the names of the hospitals? It might be U.S. Army who brought the epidemic to Wuhan. Be transparent. Make public your data. The U.S. owes us an explanation. And, this is a classic tactic in politics. You accuse the other side of what you're doing. And with governments, it always works because they're all doing the same damn thing, But it's going to be interesting because actually this is a testable hypothesis, right? What they're starting to do is look at the genomic strains of where these L and S strains emerge from and look at the very earliest people who had this. And if we start to see that all the strains were in one place at once and then went ahead and spread at an earlier time to other places, that will be the country of origin. And there have been weird pieces of evidence out there that there was some genetic information, that there were different strains that were present in the U.S. early in this. Now, could those just be individual carriers? Of course they could. But could it be something larger? Well, China's going to argue it is if it's there to their benefit. And, in any war, and this is a war like any other, the first casualty is the truth. So I'm not telling you what happened, but I'm going to tell you how you're going to construct a narrative where, as a historian, what you learn is that there's a whole bunch of facts out there, right? And that you create a narrative around the facts to tell a story you believe to be true. And it's often the case that competing narratives are equally true, and that even though we sort of agree this happened in history, we really have no clue what happened. A whole bunch of competing things happen, but we tell ourselves a story that's kind of like a fable, right? It has a certain moral element, it has villains, and it has heroes, and the reality is often more complex. There are permanent interests and permanent actors, but things are messy. People, bad guys, people who are the bad guys do good things, right? Yours truly, evidence of that. If you were to believe the standard narrative. Conversely, people who have the right ideas do terrible things, right? And in service of causes. And it's complicated. But what you get is a narrative, and what we are seeing is the construction here of this new narrative by China. In a short thread on Twitter, a social media platform that's inaccessible to China. So they're saying things propagandizing the West. At the same time, they won't allow actual Chinese to come out here. Zhao demanded to know how many of the millions of infections and thousands of deaths during the latest flu season were actually related to COVID-19. It's a fair question. I've wondered that too. The coronavirus first appeared in the central Chinese city of Wuhan late last year, and since then the pandemic has claimed the lives of thousands of people, mostly in China. And how long have we heard it's just the flu, it's just the flu, it's just the flu? That's, you wonder, I'm not trying to be a conspiracy theorist. I'm just pointing out that these are reasonable questions they're asking, and I would hope we'd have reasonable answers. As China has faced criticism, Chinese authorities have pushed back, suggesting the virus may have originated somewhere else. Dr. Zhong Nanshan, a leading Chinese epidemiologist, said in late February, though the COVID-19 was first discovered in China, it does not mean it originated in China. Zhao stressed the same point in a recent press briefing. No conclusion has been reached yet on the origin of the virus, he told reporters, adding, what we are experiencing now is a global phenomenon with its source still undetermined. One popular conspiracy theory that has emerged in China is that U.S. military athletes participating in the Military World Games in Wuhan, and this was last October, last year, and actually it was the exact same time as that Event 201, that's why a lot of people have been running with this, last year may have brought the virus into China. There is, however, no evidence to support this accusation. The Trump administration has laid the blame firmly at China's feet. Unfortunately, rather than using best practices, this outbreak in Wuhan was covered up, the White House National Security Advisor Robert O'Brien told reporters on Wednesday. It probably cost the world community 2 months to respond, he added. All right, so I understand why he's saying that. On the other hand, there's no way that the U.S. didn't have an idea of what was actually happening on the ground in Wuhan. Absolutely no way. That is total deflection. Because we knew. If people on the ground knew, they knew. Jing Shuang, another Chinese foreign ministry spokesman, said O'Brien's immoral and irresponsible comments denigrated China's efforts to fight the virus. So I have two other articles here, one from Quartz.com on this topic and one from Yahoo talking about the National Security Advisor O'Brien and how much they were really leaning into China, saying that they were responsible for this. I'm not going to read them in detail because I think that summary covered it, but I'm going to put them up for you to read in the links just because I think it's important enough to understand that there is this narrative out there. And I will say part of why you see the Chinese government pushing this narrative is there is a narrative which I couldn't find a good source from, but that has been circulating around at some time, which is that, and I have no idea as to its veracity, but it's pretty popular in China, which is that someone who was working either at the Wuhan CDC or the Wuhan Virology Clinic has been set up as a patsy, saying that they went out because they thought population, was too high and that they wanted to bring down the population, whether because it was of domestic Chinese concerns or maybe they were a climate change activist. And I'm not trying to cast a broad concern, but there are a number of people at the extremes of some of these communities who think the only way to solve certain problems is with a mass public die-off, given the lack of policy response to things. Whatever the case is, could this be an act of individual bioterrorism by a well-placed person or as someone, with the interest of some party of a state actor? Yes, it could be. And the fact that it's a viable question means that this is going to be muddied and become accusations. So what do I always say? Let's focus on the virus, right? We need to focus on defeating the virus everywhere and anywhere. But honestly, countries are not thinking that way. And China, having apparently weathered the worst of it and paying some terrible cost, which we know is at least 80,000 people sick and what's the dead count here real fast? 3,000 dead. And I will tell you, pretty much everyone who's followed this seriously thinks those numbers are a significant understatement, are going to go ahead and they're going to assume that it's going to be a much bigger number and that now, they don't want to have the geostrategic disadvantage of having to have suffered that alone, so it allows the spread everywhere. The other problem China has is, keep in mind, China has been the source of domestic or manufacturing for much of the Western world and the developing world. When this is all done, if it gets healed, China is going to lose those factories' distribution because other countries like the United States are going to learn from this lesson that they don't want to build their pharmaceuticals and other goods there. So the re-onshoring of industry represents not only a recession for China now, but a depression in destroying their sector, their industrial sector. And the deal with China for a very long time has been that the Communist Party is allowed to continue in power there as long as they provide for a level of constant economic growth. And so in that weird way, they have the same problem the Western world has. What we do with debt, they do with manufacturing, which is they want to have constant growth without this idea you're ever going to have any blowback. And now that it's happening, they are at risk of losing social stability because A, they can't provide the economic support people want, and B, they also are not going to be able to be the exporters. Well, you have C, this problem that a whole bunch of people got sick and died, and it has to mean something. What do nations do when you have these economic crises? What happened out of the Great Depression? World War II. So you have a lot of times where war follows depressions because it's a way to stimulate economic growth and to mobilize anger of people instead of against states and the breakdown of states, which happened a lot. There was a lot of shuffling, for instance, of the states in Italy during the Black Plague. You're going to have fights between states likely break out, and that gives another problem around this virus that's happening. Like I said, it's not what we want to focus on, it's what may happen. And I'm only giving all this to you because I know it sounds abstract correct right now. You're worried about survival and all that. But these problems accelerating are going to cause a problem where at some point China may pull the plug, or at least what they may do is a typical strategy. They'll say they're helping, and then they'll send the drugs everywhere else but to the countries they don't like. So if you're in the United States or a country directly allied to the United States, which is most of our audience, I'm talking to you in Australia, Canada, the UK, and New Zealand, the Five Eyes, this is going to be an ongoing problem. So there's another piece here. I would like to read it on a different day. I'm going to mention it and post it because I want it up there, but we don't have enough time to do it today. I mean, I could sit here and talk for 3 hours, but honestly, it's really hard to upload it when I do that. This is from the FT Financial Times, from Tom Mitchell, Christian Shepard, and Sherry Feiju. The coronavirus, China's risky plan to revive the economy. Beijing is targeting a second quarter rebound, but the crisis has exposed the limitations of the system under Xi Jinping. I may read this tomorrow, but I just want to mention it here because it's really relevant. What it's basically saying in exhaustive detail is that China is getting their factories back up, but they can't get their workers to them because they're scared to death of an outbreak of coronavirus resuming. And that's what we would expect to happen. And the other problem they have is their export markets are closed. So even though China has gotten past the health crisis, now they're in the middle of the economic crisis, and they are an export-driven economy. So what does that mean for public discontent, where people have had to put up with a lot of crap? And this might explain to you why the Western governments, I keep picking on the UK for this because they're just being so blatant about it. This idea we want to take all the hit all at once, no matter how many people seem to die. I mean, on one hand, you could say it's pragmatism based on the shortages of medicine that are out there. But on the larger hand, I think the reason there's some Western governments who seem to be legitimately thinking this way is they don't want to have to deal with a year of prolonged misery. They would rather have a 3-month crisis that they think they can weather. Is that better? Is it not? It's cynical. I mean, I would say that. And you know, for those who live in the UK, I would have very modest expectations for what your NHS is going to provide for you. You better be buying chloroquine and hiding at home, you know, if you live over there in Britain, and expect this it will blow through quicker. Maybe you'll have 90 days of it, but these are the sort of problems and choices you see governments making, and unfortunately, those of us citizens in our respective countries are just sitting here at their mercy. So those are some of the things that I think you're going to see going forward in terms of the international response. We're going to keep a close eye on this deteriorating relationship between the United States and China. I saw that we were having a situation where what was I going to say? We were having this situation where now we are seeing some attack ads go out there. Like, there's an attack ad that's already being sponsored against Joe Biden, the Democratic candidate, that basically accuses him of being too close to China, like he's the one spreading the... That sort of problem is really a big issue that, you know, we're going to have to look at going forward. I'm very concerned about it, so we're definitely going to keep an eye on that and see what it means for our abilities to deal with this crisis. Okay, so the last part, I wanted to put this piece out there because I have a nurse friend who listens to the show who's been giving me a lot of good information from Florida. Obviously, things are starting to get bad down there, but we've talked about the NBA closing, the NHL. We got Major League Baseball's gone down. March Madness has been canceled. I don't need to read all the stories about that. You know those things are happening, and a lot of people are awakening to a world where they realize things aren't what they seem to be. But I think this is the real tell. Walt Disney World and Universal Orlando Studios closing amid COVID-19 pandemic. And I have a piece here from Channel 4 News in Jacksonville from Orlando, Florida, saying that they're going to close on March 15th through the end of the month, and they are watching here. And that they're closing more and things open. So we're definitely going to see that's going to be an ongoing, continuing problem that is a major thing. And they are going to, if you can't anticipate this already, close down every gathering, major public space where people go to. And I am anticipating and predicting, that's the last thing you guys need me to do, get laryngitis and not be able to do the podcast for a couple of days. It'd be a crisis, right? That we're going to see that there's going to be the cancellation of most public gatherings. And we're heading towards a quarantine. There's just no way around it. The self-distancing things are going to fail. The case spread is going to continue. And somewhere 8 to 12 days later, where we've allowed the case fold to increase by 8 times or more potentially, we're going to see the effort to institute a quarantine. So I've been telling people this is a Friday show. You may be listening to this Friday, Saturday, thinking if you're going to get somewhere else, this is probably your last chance to do so this weekend if you are in an area that might be infected, New York, Seattle, California, those places. Conversely, if you are thinking you're going to travel, be mindful. Quarantines may make it difficult for you to move if that's your plan. If your plan is to bug in, getting supplies where you're at, you need to be up on. I'm adjusting my prediction. I say you probably want to have 90 days. The way we're handling this is not going to make it easy. I do think the government at some point will try to put out something between a 14 to 30 day nationwide quarantine, but they haven't planned for the food problem. They haven't planned for the logistics problems. They haven't planned for the medicine problems, and they haven't planned for the civil disorder problems. There's a large portion of Americans where if they're told to stay in, won't believe it, and they're going to cause problems for law enforcement who are not going to necessarily want to show up and deal with this, and who knows what we're going to deal with National Guard deployments if it goes that direction. And conversely, there's going to be other Americans where if they're told to do something, they may end up getting violent about it. And, I know those concerns. I share some of those concerns, frankly. Right now, we need to fight the virus. If we fight each other, we can't solve the virus. And so I would hope the government has the wisdom to not use this for inappropriate means, because there was a lot of suggestion in China that dissidents were being sent to quarantine camps so that they would basically get this and end up having to suffer and potentially a number of them die. I don't have absolute proof of that, but I know certain dissidents disappeared. I know that there were laws placed on the books for criticizing the Chinese government response that carried as much as a 7 years jail sentence, and it would be consonant with the history of that regime in China. Obviously, this is the United States. We don't want to think of these things happening. There are people on the left scared to death of the right. There are people on the right scared to death of the left. We're going to have to get past that, or we'll never get past the virus. So I just submit that to you. And as we do that, we're going to come into a piece here. We're going to talk about Boston in exhaustive depth here. So it's about 9:05 a.m. It looks like, let's see what time this is. And people keep calling. And, the hardest thing, I record this on my phone, as some of you know. I should separate it out, and I'm going to try to take some time this weekend to figure out how to do that. There's reasons I do that, but they have a lot to do with the fact that I'm not an audio engineer and that I have an easy program to use in this. But we're an hour 45 into Coronavirus Central, so we'll take the next half hour or so, talk about Boston, talk about the problem there, talk about the solutions they're planning, and it's a good idea of what to expect, and some good policy planning actually down in Massachusetts for how to deal with this. It may not be adequate, but they're trying to do what they can in light of the restrictions and problems they have. So we're going to start with a piece from Bloomberg. This is a prognosis from March 12th, and it says, the Massachusetts virus outbreak looks a lot like Italy's just 2 days ago. And this was written by Prashant Kopal, Bailey Lipschultz, and Michael McDonald. Published, it was updated at 10:48 Eastern yesterday. At the Northeastern University Emergent Epidemics Lab, researchers have a convenient petri dish for studying the spread of pandemics, their hometown of Boston. The city is one of the major coronavirus clusters in the U.S., along with Westchester County, New York, and Seattle. In Boston, it all began with a February 26th meeting at the Boston Marriott Long Wharf Hotel, near the tourist mecca of Faneuil Hall and overlooking Boston Harbor. It's when it gets real to you. I've been to that hotel, not recently. There, about 175 executives met from around the country and then unwittingly spread contamination across the city and likely around the world. Ironically, they were from Cambridge, Massachusetts-based Biogen Inc., whose very mission is to develop drugs rather than spread disease. The region is known for its top-flight universities and hospitals. Now those institutions' very experts, along with its public officials, are well-positioned to figure out how the disease is spreading from that conference through the Boston metropolitan area of 4.9 million people and beyond. The city now reminds modelers of how matters unfolded in hard-hit Italy, whose hospitals have been overwhelmed. Massachusetts is smaller than Italy, said Sam Scarpino, assistant professor of network science who heads the epidemics lab at Northeastern. It has about 100 cases. There were 159 cases in Italy 2 weeks ago. That's where we're headed. We've got to move now and decisively prepare hospitals, work remotely, and ramp up testing. Scarpino works in a small office on the second floor of a concrete off-campus building. A map of the 19th century whooping cough outbreak hangs on his wall. His six-person team focuses on New England, New York, and New Jersey. He keeps frequent communication with other Northeastern labs and the 10th floor of the building that's modeling the virus across the country. Whether the situation here becomes as dire as Italy or infections remain more restrained will depend on research initiatives such as these and Boston public health initiatives to slow down the spread of the virus. Italy's reported 12,462 cases on Tuesday and 827 deaths from COVID-19 as the disease caused by the virus is known. The virus has led to fatalities primarily of older people or those with other health problems. As in the rest of the country, researchers in Boston are hamstrung by the government's slow rollout of testing. The Biogen meeting in particular is a puzzling case because it resulted in so many infections. The lab is focusing on a number of hypotheses. Could it be something about the ventilation system that promoted the spread? Well, we've seen that happen elsewhere. What if several people arrived at the meeting already infected? Why this meeting when so many others of the same size were happening across the U.S.? It may take another week before Scarpino has enough testing data to make any public predictions about the scope of community spread in Massachusetts. But he's leaning toward the idea that the actual number of infected state residents is likely many multiples of the 95 positive tests announced as of Wednesday. Based on the experience in Italy, China, and South Korea, he said the number of new cases is doubling every 4 to 7 days. In the U.S., the 5 cases and 1 death reported Tuesday in South Dakota is a warning flag that community spread is wider than what the authorities can capture. A cluster of cases in small states that are much more isolated, like South Dakota, is compatible with a much higher case count that we're not seeing because we're not testing, Scarpino said. The detective work starts with a fuller picture emerging about what happened at the Biogen conference. Their colleagues from around the world greeted each other with handshakes and hugs and picked from plates of pastries and a self-serve hot food bar, according to a detailed reconstruction by the Boston Globe. I mean, the reality is all social activities are going to spread this like crazy. Someone sneezes on the food, there you have it. Those in attendance included 1 or more individuals from Italy, a Biogen spokesman said. All of those at the conference were invited to dinner near Faneuil Hall. That's like the city center of Boston. That's like their big convention center kind of thing. On March 5th, more than a week after the event, the company said a number of attendees reported different degrees of flu-like symptoms. At least 3 tested positive for the virus. Of those initial cases, 2 employees were based in Europe, a company spokesperson confirmed. Biogen required those who attended to work from home for 2 weeks. The firm advised authorities who did not feel well to stay home and contact their doctors. Man, I've been reading too much. It's starting to show, isn't it? But it was too late. Some Biogen employees with the virus had already attended an investment conference hosted by New York-based investment firm Cohen & Company on March 2nd at the Boston Marriott Copley Place. Or it's Copley Place, I'm sorry, I know how to say that. The conference, which hosted more than 325 public and private companies, did not alert attendees until Sunday that at least 1 Biogen employee who had attended tested positive for the virus. They had continued to meet and go about daily life for almost a week after potentially coming in contact with it. So far, 77 cases have been linked to the Biogen conference. It wasn't long before its contagion left the city. 2 attendees of the Biogen conference in Boston who have tested positive for coronavirus later attended a private party of about 47 people in Princeton, New Jersey, according to local officials. At least 2 people who attended the party are residents of a nearby town, South Brunswick, which closed schools on Wednesday, even though no South Brunswick residents have tested positive for the illness. Those who went to the party were asked to self-quarantine until assessments and any testing was complete. But the shock waves are most powerfully felt in Boston. Other biotech companies, including Boston-based Vertex Pharmaceuticals, have told companies to work from home. Boston Mayor Marty Welsh canceled the city's St. Patrick's Day parade. Conventions are being postponed or canceled, and on Thursday, Marriott said it would close the hotel that hosted the Biogen conference. Massachusetts Governor Charlie Baker on Tuesday declared an indefinite statewide emergency which gives him the authority to cancel large events. Baker, a former chief executive officer of Harvard Pilgrim Healthcare, which has more than 1.1 million members statewide, banned travel by many state employees and waived attendance requirements for schools. Boston Brigham and Women's Hospital, Boston Brigham and Women's Hospital activated a drive-up virus testing facility in its ambulance bay. Patients remain in their vehicles, rolling down their window for staff to collect a sample to be sent to the state's lab for testing. And we actually reported on that last week, that they were going to grab that from South Korea. And I have had, just a quick interjection here, I've had a chance to talk to two people in the Boston medical system, who are reporting that they are shutting down non-essential actions in anticipation, that they're going to need more support, that they are beginning to roll out in concordance with international actors, local solutions that will work for the Boston area rather than relying just on the CDC given its poor performance, and that there is a rising caseload and concerns within the ER department of at least one hospital there, that they're seeing more cases they suspect, but they're saying here, the testing has been lagging. So, and that's something I'm hearing from all around the country. I'm certainly not trying to scare my friends in Massachusetts, but this is something that's going to be something we all experience. But I'm sharing Boston's example because it's actually a good story about that they're being proactive at the local level rather than reactive. And I think the people of Massachusetts will benefit from that as opposed to other places where they're waiting for things to happen. I mean, a little bit of credit here up to New England, and there's an opportunity for other places to begin replicating this, as well as the things that were done in Washington, I would say. I think that they've tried really hard to get in front of it, as we've reported, and you need to do this regardless of where you live. Governor DeWine in Ohio, for instance, shutting down the school system. These are all good actions. Okay, so Harvard University, University of Massachusetts System, Boston University, Northeastern, and the Massachusetts Institute of Technology have canceled in-person classes and moved to online instruction. Many students are away on spring break and have been told not to return to the campuses. At Harvard's Cambridge, Massachusetts campus, empty moving trucks were parked on the lawn outside of a residence hall, and stacks of flattened boxes piled up near an entryway. Ethan Kipke, a senior computer science major, was heading home to the Philadelphia area for spring break and wondered what the cancellation of in-person classes will mean for his graduation. Quote, "This is more abrupt than experience," he said. "We're trying to figure out what's going to happen." Coronavirus is spreading into Boston suburbs, such as Wellesley, which sent students home from two schools last week. 11 town officials in nearby Norwood have been self-quarantined after coming into contact with a COVID sufferer at a private event. The Norwood officials include the town school superintendent and its general manager, who has since tested positive for its disease. The outbreak's impact has, of course, reached the academic researchers at Northeastern. Members of both labs have been working from home. Scarpino, the lab chief, has been counseling hospitals that are in the dark about how many negative pressure isolating tents they'll need for the coming onrush of patients. The big problem right now for our forecast for Boston is we haven't run enough tests to know whether there are 100 cases, 1,000 cases, or 10,000 cases. Well, we know our government's expecting this number to potentially be between 40 to 70%, so you better figure that number's going to get a lot higher. But at least they're in front of it, and they're trying, and if they can track it in the area, then that gives them time. What are we doing with flattening the epidemic curve? That saves lives, and it means that the people who go get sick can get better care. Okay, there's another article here. I'm not going to read the full thing because there's a lot of overlaps, but it's a good article. It's worth reading. Single conference linked to most Massachusetts coronavirus cases looks like a super spreading event. This is from 90.9 News WBUR out of Boston. And they're saying, I'll just put this here, just so you know, the super spreaders here. I'll read the start of this because I don't want to read the whole thing. Among the coronavirus numbers that Massachusetts officials have shared recently, one is particularly striking. Of the 95 cases the state has detected as of late Wednesday, they say 77 had stemmed from a meeting at the Cambridge biotech company Biogen held in late February. Like in public health parlance, the Biogen meeting is looking like a super spreading event. Perhaps you've heard of Typhoid Mary, the New York cook who spread typhoid fever in the early 20th century. She used to be seen as an anomaly because it was thought that everyone was more or less equally prone to spread a disease. But now it's known that super spreaders or super spreading events are common in epidemic, including SARS in 2003 and a measles outbreak in Canada in 2011 that appeared to stem from one patient's stint in the Montreal airport. Yale professor Nicholas Christakis, a physician and sociologist who studies networks, says the current outbreak in Italy also stemmed from a super spreader. We know from genetic analyses in Italy that the epidemic there was started, we think, by 2 people, one of whom gave it to 43 other people. The question arises when we see a super spreading episode like this at Biogen appears to be, what's the cause of it? Is it just chance, or is it something to do with the particular circumstances? Though super spreading has been documented in one epidemic after another, it's not well understood. We certainly think biology plays a role, says Dr. Ashish Jha, professor of public health at the Harvard Chan School of Public Health. Some people end up having a very high viral load and they shed a lot more virus than other people. It may be something with your immune system, something to do with how that immune system is reacting to the virus. Initial findings suggest the coronavirus could be quite contagious early on, possibly before even symptoms show up or get bad. You know what, I am going to read this because this information is useful to you. Christakis from Yale says other factors could cause people to become super spreaders, like even a propensity to cough. Maybe they have lung disease, for example, he says, and so they're doing more coughing anyway, and so compared to a person who doesn't cough, they transmit it more. The environment can contribute to spreading too, he says. Poor ventilation, overcrowding, or a super spreader may just be more gregarious. They meet more people. So there are many types of situations or circumstances that can contribute to the phenomenon of super spreading, says Christakis, author of Blueprint, The Evolutionary Origins of a Good Society. And it's not always possible to know, or it's typically not possible to know in advance, who or under what circumstances are going to get a super spreading event. So that's part of why large gatherings are a bad idea right now, Harvard's Ashish Jha says. If you have a super spreader in a crowd, it can really make things explode. And the name of the game right now for America is a slow and steady rise in infections. We've got to stop explosive growth because that's what's going to cripple our system and really harm people. And super spreaders can end up being an important part of that problem if we get them into large groups. In retrospect, Jaws says, Biogen probably should have canceled its meetings, but I understand that decisions were easier to make in retrospect. They absolutely are. And you need to not be having these big meetings. You need to minimize contact as much as possible, but we see this isn't happening. Now, Boston is jumping ahead of the line, Seattle is, some of these cities, but even then, we're still responding, and I know for a fact, because I know people there in Boston who are behaving, and what are they doing? They're out panic buying. You get one super spreader walking through the doors of a Star Market in Boston that coughs on the front door or something, and you could have a little thing sitting there that people are walking through, one after the other, or, you're grabbing bananas, you're grabbing produce, and I don't mean to scare you. But it's just the reality of it. I will say, if you're going to be doing your panic shopping, don't go where everyone else is going. The whole thing you're preparing for may be in front of you if you are in an area where you have any reason to believe. And that's a lot of places, unless you're in a rural or isolated area, that there are those dangers. You have to be incredibly mindful of those health risks. Now, can you mitigate those? Absolutely. They talk about good hand cleaning. That's a big part of it. Not touching your face, yeah, but having a mask in some way to protect your eyes, probably pretty important too, especially your nose. I don't know the percentage likelihood you have of getting it from various entry points. We never really seem to know these things, but I would imagine if you could protect your mouth and nose, you've made a big step forward. Even if you have to wear sunglasses, it's better than nothing. So, to that extent, I'm going to tell you a little bit now about some of the preparations happening in the Boston area. And for people who are in smaller communities or larger cities, these offer opportunities for things that you can do to protect your first responders, your healthcare personnel, and things that will be helpful that we want to go ahead and implement, and as well in your own life. So this is from the Boston Herald. And this was published, I'll read the headline. The Boston EMS prepares for the coronavirus. The new normal will include face shields and protective gloves. So you see that the paramedics are being set up, and there's a lot of pictures of this. They have an N95 mask. They have a splash shield on their face. They're covering a plastic protective gear with nitrile gloves, so they look a lot more able to protect themselves. We had a number of stories we came out of Washington early, like the firefighters in Kirkland, where they were getting sick because they were responding to people and they were not under proper protection. We need to see actions to move forward with this quickly, and that's going to be another supply shortage we can anticipate. But if we can have those supplies prevent the spread, then maybe we reduce the usage on the back end. So that's, I think, a good usage as a preventative act. And it keeps your thing alive because you're going to need to have ambulances go get people who are really sick, right? Expect to see far more emergency responders decked out in face shields and white protective gloves, but it doesn't mean they're transporting someone with the virus, Boston's EMS chief says. For a little while, this might be the new normal for us, said EMS chief Jim Hooley as he stood outside of EMS headquarters in the South End on Thursday. In light of the possibility of community spread of the virus, and I think it's the reality of it, and I'm glad they're responding this way, emergency operators are now asking callers if the people who need attention have any sort of respiratory illness. Then we tell our personnel to take precautions before we even get to the scene or get to the patient, Hooley said. So far, there's been pretty good control here, but prudence dictates forward thinking. He had one of his emergency responders model the getup for reporters. He wore a plastic shield in front of his face and still had a mask on underneath over his nose and mouth, plus a disposable white hairnet, smock, and booties. We will put this on, examine the patient, and cocoon the patient in sheets. Just wrap them up with a mask on them. Hooley said of treating anyone they suspect might have the rapidly spreading virus. He said they would then call the hospital and let them know a patient who needs to be quarantined is coming in. You see us putting on more in lots of cases, and it still might be the flu. It still just might be something else, Hooley said. That doesn't mean when we walk out that something like this, we're bringing somebody out who's a COVID patient. He added, it also doesn't mean there's hundreds of cases. We're just telling our people better to be safe than sorry. And that's really good that they're putting it on the patient as well, because that really is going to protect the people around who are coming there. Hooley said none of his men or women have had to self-quarantine and none have been diagnosed with the coronavirus. Right now, equipment-wise, we have sufficient stores on hand, Hooley said. He said they built up supplies following the H1N1 flu scare of a decade ago and Ebola virus from 5 years ago. We need a healthy workforce. That's our biggest thing, is to protect them, Hooley said. A total of 108 people have tested positive for the virus in the Bay State, an uptick of 13 cases from Wednesday, according to Massachusetts Department of Public Health. And it seems like they are doing their own contact tracing, which is very aggressive. Very glad to see that. 6 of the cases have been confirmed by the CDC, and 102 of these cases are presumptive positive cases. Out of the total 108 people who have tested positive, 82 are connected to the Biogen conference in downtown Boston from late February. Suffolk County, which includes Boston, saw its total rise from 19 to 22 overnight. Governor Charlie Baker on Tuesday announced a state of emergency because of the coronavirus outbreak. More than 1,300 people in the United States have been infected. There have been 127,000 confirmed cases around the globe. So that is what's happening in Boston, and that's by Sean Philip Cotter, who is a reporter here with the Boston Herald. Okay. So, I want to give you just a little more detail. We're going into it, but that's a really good step that they're taking, protecting their first responders. It's something that you should try to do. And if you know you're going to a situation where you think there's going to be a flu or something, maybe you don't have that level of equipment, hey, you can protect your hands, you can wear some gloves, you can go ahead and protect your face. Go ahead and do what you can do. You know, something is better than nothing, right? Okay. This is also from WBR 90.9. Harvard global health expert. Massachusetts hospitals face capacity problem if coronaviruses spike quickly. And this is another example. We looked at this from Seattle, Washington. Now we're going to look at this for Boston because it's giving you a feel that this is a universal issue. And whether you live in the United States or not, this question of what you can handle, your ICU capacity, your supplies, is going to be the key determinant of what ends up being the case fatality rate. The Chinese inception, the Iranian tragedy, and the Italian crisis all show that systems get overrun, the death rate spikes. And what that hits, we had the early modeling said Wuhan at 18%. So I've been using that number. It's suggestive. Hopefully it's lower than that. Maybe it's higher. We don't really know. We do know that it increases by an order of magnitude over what happens if you can give everyone the ideal treatment and if you have a well-functioning system. So we're looking at this for Boston now as an example of what will be the case in your city, because Boston is no different than any other major U.S. city, except that perhaps they're being more proactive than some. All right, coronavirus cases are mounting in, or actually I should say, this is by Lynn Jolicoeur and Lisa Mullins, March 10th. Coronavirus cases are mounting in Massachusetts. State officials announced Tuesday 51 more people had tested positive since the day before. Hospitals are focusing on capacity and whether they're equipped to handle a possible surge in patients. Italy has a top-notch healthcare system and has been overwhelmed by an explosion in coronavirus cases. Hospitals in the northern region of Lombardy are in danger of running out of intensive care beds. So we're just going to skip. And they had Dr. Ashish Jha, who was mentioned in the previous article, evaluating prepared hospitals in Massachusetts and how they're going to be able to deal with the potential onslaught of COVID-19 patients here from Harvard. And here are some of the highlights of what he had to say. Some of the best epidemiologists in the world are estimating that between 40 and 70% of adults will end up getting an infection. Even if we begin at that low end of 40% of adults in Massachusetts, that's 2 million people getting infected. If we take data from China that says 20% of people need hospitalizations, that's 400,000 hospitalizations. Even if we said, no, that's too many, we can cut that at half, that's 200,000 hospitalizations. At any given time in Massachusetts, we think there are 3,000 to 4,000 hospital beds open at most. And so if you start doing the numbers, you very quickly realize we do not have anywhere near capacity to take care of tens of thousands of people with COVID who might need hospitalization. But if we can spread that out over many, 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 many months, ideally a year, then I think we have a shot of being able to take care of everyone who will need the care. And that requires a lot of public cooperation, a national level response, because you can't have people coming in and out. And that's why we've been saying to prepare for extended shutdowns. But how do you keep the economy moving? And by that, I don't mean to finance the Dow Jones. I mean this question of how do you get goods and services that are desperately needed to people who are not prepared. This is why I've predicted that the sort of modeling that allows us to get through this flat isn't going to happen, and we're going to see just how bad that bump is the longer we take. And his research fits entirely what we've been saying on this podcast and what we've reported from big epidemiologists. And you can do your own studies. In fact, you should. Don't just take what I say or what an expert says. Figure it out for yourself, what you think is going to happen, and get in the habit of making your own projections, for your own area, because you know the key factors now. You know the supply shortages. You know your hospital capacity. If you live in Greenville, Maine, a hospital, that has 1,600 people, that's servicing 1,600 people for an area with about 10,000 people that has just a few beds, you're going to have a critical crisis the moment this comes in here. So you adjust your behaviors accordingly. And that's as true for rural folk as it is for urban folk and for what exists in your country if you are not an American listener. So that's asked him, how does this happen? How does it spread out? So what we know is that this idea that people just talk about social distancing, which is why Harvard University just today canceled classes. In-person classes were going online. In our offices, we are now encouraging everybody to work remotely. Certainly, all large gatherings should close. I'm pleased to see the city of Boston canceling the St. Patrick's Day parade, a parade I've always loved watching, but I think now is not the right time to have it. Getting all of those mass gathering events is going to be absolutely critical to spreading this infection out over time. And then the next question was, when you talk about reducing the crunch on hospital beds, are you saying that hospitals need to do that right now, clear out beds, make more available? So right now, the problem that hospitals are facing is because we've had a complete fiasco of testing and our inability to test people. Hospital beds are filling up with people under investigation. Maybe they've traveled somewhere, they have symptoms, and because testing has been so slow and difficult, they can't get tested quickly and eliminated. So they're sitting in hospitals, they're in beds, and they're in places we want opened up for people who actually have the infection. And it's not the hospital's fault, and I have to tell you, it's not the state's fault. States are trying very, very hard here. It's the federal government that really dropped the ball on the testing. Once, and that goes right to the CDC. They deserve all the blame for this, really. I mean, honestly, it is that simple, because they said we got this, and then they didn't. And they had the authority to take control, they did, and they failed. Once we finally fix the testing problem, which hopefully will happen very soon, and we can test people more broadly, some of those beds will open up. But I think it's a matter of weeks, not months, before hospitals face a real crunch. And what hospitals are going to have to do is they're going to have to cancel elective surgeries. They're going to have to think about converting things like operating rooms into ICUs. They're going to have to think about where else they can put patients and where they can take care of them safely. We're going to have to start thinking about things like ambulatory surgical centers, and we can use them as places for very sick people. We're going to have to get very, very creative about expanding the supply of hospital beds and ICU beds, particularly if we're going to get through this period. And keep in mind, we talked about beds, we talked about personal protective equipment, that's keeping your staff and making sure they show up. That's a question. This is America. There's going to be that issue. And we talked about the two things that I don't think are getting covered enough, which is the shortage of ventilators and the medical supply shortages. Any one of these can destroy every other one of those, which is why you want to keep the case number down and you want to space it out. So the final question in this interview is there a great disparity in the availability of hospital beds and ICU beds, particularly in different parts of Massachusetts? There is obviously a great concentration of hospital beds, especially ICU beds, in eastern Massachusetts and the greater Boston area. Of course, that's also where a large chunk of the population is. But once you get out to western Mass, it is much more of a problem. You have far fewer ICU beds out there. In the Springfield area, we estimate 70 to 80 ICU beds. If cases spike out there, you might see a lot of those patients coming into central or eastern Massachusetts. So this is something you should anticipate if you are in a city that does not have a lot of hospital capacity, or that's basically a feeder city for a larger regional city, is that they're going to have to theoretically transport you there, and what's going to happen is they're not going to be able to do it because the resources won't be there, which is why in a lot of ways, even though the cities are most at risk up front, they will have access to more care. If you're in a rural life, yes, you are at lesser risk, but you're going to have bigger problems if you get infected, so please keep that in mind in your own behaviors. Okay, we have one more here, Matt, that I wanted to share with you. Let's see what else I got in here. All right, so I got two more, just some quick ones we're going to hit for details in Boston. I'm sharing all these because people are asking, you want solutions, so do I. I'm telling you what they're doing, and all of these are good ideas for hospitals to act. You know, realistically, if we're going to succeed through this in any sort of meaningful way and begin to mitigate deaths, because we're not going to cancel the crisis. The government doesn't have the mindset to do the things it needs to do this, and it's become abundantly clear. But what you can do in your local area, whether that's your city, town, your state, I know state officials listen to this podcast, have been told as much, don't worry, you can take credit for it. Follow some of these good advices depending upon what resources you have, and don't be afraid to be creative. It's easier to ask forgiveness than permission, and keep in mind that a lot of things that don't follow regulations are going to look brilliant. The reason why people in Seattle, Washington are alive today is because the Seattle flu study purposely misdid something. They saw a problem. The CDC said don't do it. They told you them screw off. And I would suggest, given what we've seen from the CDC, that's a pretty good strategy for people, one we should continue and accelerate. Massachusetts hospitals gear up for challenging battle with coronavirus. Tufts Medical CEO says Italy may preview what lies ahead for the U.S. The spread of coronavirus has put Boston on edge as they prepare their hospitals for worst-case scenarios. We investigate with the CEO of Tufts Medical Center to find out what Boston Hospital is trying to do to stay one step ahead. I think it could be pretty bad, said Tufts Medical Center's CEO, Dr. Michael Apcon. And for a sense of the worst, people should pay attention to what the citizens in Italy are experiencing right now. We believe we will need every possible bed available, particularly the ICU beds. The hospital is now restricting access to only people who really need to be there and rescheduling appointments and surgeries that are discretionary and elective. Apkin said that the step may not reduce the number of people infected over time, but it may do something else. Okay, one quick interjection here. So South Korea has done something better than Boston here, and I want to suggest it for the people in Boston listening, as well as for other people. You need to get some of those early cases on a treatment protocol when they are seen as respiratory sources, when it's not severe, rather than just telling them to stay home unless they have this pneumonia where they become a high mortality rate. We need to begin setting up measures for them to get access to whoever use the chloroquine and zinc treatment protocol South Korea is looking at, remdesivir, whatever they eventually approve and that they can provide from the FDA. That's how you can also help mitigate risk. A thought, maybe you take urgent care facilities or take branch practices. A lot of smaller general practices and systems are going to begin shutting down because they don't want to be contaminated with this virus, and use those as triage clinics for non-severe cases with a standard protocol that's being treated. It's something that we can do. It would help save a lot of lives. And, if we could do that as well with with South Korea. North Korea, Kim is shooting the virus and keeping it out. But, hey, at least he closed his borders early. They might be doing better over there. I'm not making fun of the guy. If we can go ahead and convert, like they're setting up these fast food sort of triage-looking clinics, maybe like they're doing at Brigham and Women's Hospital, you can go ahead and say, here's your test kit. If you start having these symptoms, here's a 14-day case of chloroquine. Be prepared to take this. I realize that that's different than how we've thought about medicine, and I realize that hospitals will be scared to death of lawsuits of the FDA, the CDC, all these entities doing there, but these are things that we can do and that maybe we need to figure a way to. If we need to have a doctor do a 5-minute check on someone that at least says, like they do with the urgent care clinics to get antibiotics out for other things, maybe we can do this. It's just a thought that popped into my head, hopefully a useful one. if we can, meanwhile, Dr. Apkon said, if we can create distance and slow the interaction between people, we will see a more gradual upstroke, a much lower peak, and a much longer pandemic, he said. But that might allow us to keep demand on our services to the number of ventilators and ICUs that we have. So they know the problem. That's good news. Right now, 293 of Tufts' 415 beds are occupied, and that includes 98 ICU beds. The hospital says it has the ability to add more beds for COVID-19 patients if needed. The news asked, this is a transcript of a news interview, so I have to change the words a little bit for this to read logically. They asked if Tufts Medical Center will have enough critical care beds if the spread of the virus increases significantly. Nobody can answer that question because it depends how many people are affected at any point in time, Apkon said. There are about 15,000 hospital beds in Massachusetts, but not all of them are critical care beds, Governor Charlie Baker said Thursday. The state is working to ramp up resources for all hospitals, including the number of medical personnel. The Board of Registration in Nursing was able yesterday, under that executive order, to put in place an emergency procedure that will make it possible for licensed out-of-state medical professionals and nurses to get licensed here in Massachusetts in one day, Baker said. So for those who don't understand the nursing profession, which I do because I have a friend who's a nurse, there's at any given time a large number of travel nurses that go to different places. They have certain restrictions about where they can go. Massachusetts is making their claim to sort of lap them up. Now, is that going to be enough to cover this? No. But there will be a lot of people, and what you will probably see, as we saw in Italy and that we have seen in other countries, is a drive to bring people in who are either in the process of becoming medical practitioners, field promotions to nurses for the duration of this crisis, and you will see retired personnel being asked to help support the efforts, and that will be needed as what is called surge capacity. So we got one more article here that I think speaks to that, and this is from March 10th by Alexi Cohen at the Boston Herald. Local hospitals screen coronavirus patients in outdoor tents away from emergency rooms. And what are they trying to do? They're trying to prevent that problem that we've seen that is really pronounced with COVID, which is that one sick person with coronavirus in a hospital waiting room means that you have potentially a super spreading event. And they are trying to anticipate the problem to extend the pandemic curve and mitigate this. Another really good decision. Massachusetts hospitals are creating alternative spaces such as outdoor tents, taking advantage of the ventilation, right, to deal with potentially contagious coronavirus patients as cases in the state near 100 and the CDC discourages face-to-face triage. As part of our COVID-19 planning and preparedness, South Shore Health is setting up 2 alternative care spaces outside its emergency department, read a statement from South Shore Health on Tuesday. The tents on the hospital are similar to those used during large events such as the Boston Marathon and can serve for screening, evaluation, and treatment of patients if necessary. South Shore Health created the spaces in response to the Massachusetts Department of Public Health call for hospitals to identify areas to accommodate a surge in patients requiring coronavirus screening. Proactive, anticipating problems, getting in front of it. Yes, why can't our federal government do this? DPH Commissioner Dr. Monica Burrell said in a Tuesday press conference, "We are at a critical point in this outbreak," adding the community spread is beginning to occur in Massachusetts patients. Brigham and Women's Hospital is also employing out-of-hospital testing, which is set up in its ambulance bays. The method provides an efficient and effective opportunity for these individuals to be screened while limiting exposure to both hospital staff and other patients, read a statement from the hospital. Tufts Medical Center and Boston Medical Center both said they are not currently using out-of-hospital coronavirus testing spaces. So, that's going to be a problem. In addition to creating new testing spaces, the CDC is encouraging medical professionals to explore alternatives to face-to-face triage and visits. The CDC recommends using patient portals, online self-assessment tools, and advice hotlines. If a patient experiences coronavirus symptoms, hospital staff should consider telehealth interactions with patients instead of in-person appointments to reduce the risk of transmission. Absolutely, but how are we going to get them drugs? We got to think about that. The State Public Health Lab received a surge of 2,000 test kits from the CDC and got federal approval to automate one step in the testing process, increasing the testing capacity from 50 a day to 200. Keep in mind, South Korea is a country that is managing to do 20,000, so Got to do better. The state lab is doing a superb job using the test kits we have, said Burrell, noting the 24 to 48-hour turnaround time. So far, about 400 Massachusetts patients have been tested, and there are a total of 92 positive cases. So, those are your updates from Boston, and it's a city that is trying to get in front of it. It's a very good example of what's happening. If I wanted to use an example of a city that's not handling it well, we could use Houston, Texas, which we talked about, who said, we're not going to cancel the damn rodeo no matter what. This is Texas. And I'm not making fun of Texans, because actually the only reason I know about it is a number of people in Texas reached out to me and specifically asked me to draw attention to this in hopes for the protection of people. All of these measures are good. They're important, and they're a big step of it. They keep our health responders in the game. They will save lives. But the biggest thing they need is the cooperation from all of us. We have to change the way we live, and here's our choice. It's real simple. We could deal with a lot of pain now, right? And we could shut it all down for a month. We could take it easy, relax, or take a week, make sure everyone has enough food to make it, and get through this. Or we could go around and say, it's a hoax, we're not going to do it, a quarter of the people run around, and this continues to spread. Remember, if you even have 10% of the people in the United States going around doing this, that's 33 million people going to public places, and an outbreak that's probably in some places reaching the point where if you're in the wrong place, you'll get this. So it's definitely a difficulty. We don't have masks. That's what prevented the thing from getting really bad in East Asia in a lot of their countries, because they had the experience of SARS and H1N1. And in fact, when we were reporting on Boston there, the EMS chief said they had the supplies because they had prudently prepared based on what happened on Ebola and H1N1. One of the things that you have to understand as we're going through this crisis is that it's important to talk about the worst case scenarios, prepare for them, and act as if they were true so that you don't experience them. That's why I go out here and scare the hell out of you every day and tell you we are going to deal with potentially, anywhere from 20 to 80 million dead in the United States. That's what happens if we get everything wrong, okay? And then you have all sorts of nasty things. And look, our federal government is making huge mistakes. Other people are taking their lead according to them. The CDC has had error after error. The NHS is saying we're going to let this happen. Canada isn't doing very much. In fact, Justin Trudeau is now under quarantine. I didn't even report on that, and his wife is confirmed to have the coronavirus. So this is something that's spreading widely. It's going to cause a lot of problems, and the extent to which we are able to change our own behaviors is the single greatest determinant. That's what Coronavirus Central is about. We keep each other safe. So what does that mean? Put the politics aside, put all this aside. The way that we beat this virus and the way that I look like, all my predictions go wrong, which I very much want to happen, and it's the reason why I do this, is if all of us change what we are doing to go ahead and be ready for this. So take the time, begin getting prepared, get yourself ready now. I'm not going to pretend that I think it's going to work out in the best of all worlds. In fact, I actually expect the opposite. But the great thing is there's every opportunity to prove me wrong, and it's up to the American people and the people of the various countries of the world to take those actions to make that happen. At this point, if we go ahead, we prepare, and we take it easy, those of us who do that will survive individually. That means taking your kids out of school, not going to public gatherings, protecting your eyes, protecting your mouth, practicing good hygiene, hand washing, all of those measures, and ultimately accepting that we're in for a ride here. It's a dangerous time. We're in the bunker. I get that. I've been here since January because I was scared to death of what I saw in the numbers. I want you to be prepared. I want you to be safe. And hopefully this information will be useful. So I will do a show tomorrow just as an update. I'm hoping to have a more upbeat, a lighter, shorter show. It may not be lost on you that my voice is beginning to fail a little bit. I have been talking to so many people for so many hours, helping families, individuals across the country, across countries actually. I've been talking to people, trying to give advice, support. So if you have questions and you shoot emails, I answer them all. If I can do something, I read them all for certain. Coronavirus Central at pm.me, or you can send me a message at Twitter at coronaviruscast. I will come on at 7 o'clock tonight on the show. That's what's there for you to answer your questions. There'll be a link at the Twitter at coronaviruscast, as well as to the general YouTube channel. So if you subscribe and put a reminder, we can talk about other issues. We'll go into some of the details we could not cover today. I do expect to have a shorter show on Saturday. I just need some time to recharge. this has been a hell of a week for all of us, I'm sure, and it's only going to get crazier. I'm prepared, so I'm going to be resting and helping others prepare. This is the week you need to be moving, get in action. By next weekend, be where you want to be for a long time. I think that there is a very high probability that the federal government will try to do things the small way and continue reacting, that we will see probably 8 to 12 days from now when we deal with, I would say, probably about 8 times the amount of cases nationwide, and the actual panic reaching the level that the national disaster declaration will come from President Trump that's been talked about, and that you will begin to see travel restrictions. And I suspect in the hardest hit areas, which I think given their actions, I would suspect you're going to see this earliest in the San Francisco, Seattle, and New York areas, you will see extensive restrictions start to be in place. Be aware of your food supply. Be aware of where your food comes from. Don't assume you're going to be able to go to the market. The government is going to go out. They're going to project, we got this. They're going to tell you, we're going to give you money. We're going to give you food stamps. We're going to give you benefits. How do you use them when there's nothing on the shelves and no one's there to sell you the food? They're not answering that question. Anticipate problems before they arise. Do not get caught in bottlenecks that are key to your survival, and you will survive a very long time, my friends. That's your goal through this. That's my goal, and that's our goal in our nations, whether you're in the UK, the US, France, Germany. And what I want to say is just today, as we close week 6, well, we got one Saturday episode, but as we close week 6, a prayer, I just ask Heavenly Father that you bring relief to the suffering that are out there, and give strength to the courage to the doctors, the nurses, the first responders, those people on the front line who are facing death so we don't have to, and that you give them mercy to the suffering so that those who pass do so without more anguish than necessary, and those who have to witness it find the character to overcome this. And just to say that we are so proud of all of them, and that our support and our love is with them, and we hope you will be with them also as we hopefully learn from this terrible pandemic how to be better people, and that your grace will shine upon us. So in the Lord's name, amen. I will be back, like I said, to expect a little bit later show tomorrow. I was promised that, and I always end up getting early because I sleep really poorly, right? Who can sleep well with this stuff? You sit there and you're looking at it, and you're like, just like me, just a quick thing before I leave you. I get up and I look at this and I come on and I tell you, people think it's doom porn or fear mongering. I'm coming up here telling you, do you think it's fun to get up every morning and tell you that I think this many people are going to die and all these mistakes are going to be made? I feel like the most helpless person in America many days, despite the fact I'm well prepared, because I'm sitting watching in slow motion a thing happen which is utterly preventable if any number of different actions will happen, and understanding exactly why it won't happen, and then listening to the people responsible for this thing blame people like myself or people like you, the audience, who've prepared. We've all dealt with this, right? Family and friends who we want to help who now come to us, and some of us can help and some of us can't, and there's challenges because like I have my wife being immunosuppressive. I can only do certain things because if she gets this, she's in a high-risk morbidity group, and we had to separate very early because we were aware of that, but we try to help people where we can, and this is what we do in this show. That's what you do. We'll talk about that tomorrow. Have a good day. Enjoy the day. Try to get the things done you have to get done. Get close to your family. And one suggestion, at the beginning of this, we gave a lot of practical preps. Let me give you one really important one. If you're going to hole up, think about who you want around you, the opportunity to reconnect with families, friends, loved ones, someone you want to be around, pull some resources, some skills, and we don't know what's going to be on the other side of this, but think about who you want in your life, who you love, who you care about, who's been there for you, who you want around, and have that person near you in this time. And if that person's far away, it's not that big of a country or that big of a world. If you have the means to get from A to B, go ahead and do it. God bless. You guys have a great day. This is Coronavirus Central. All shows available at coronaviruscentral.net, and I will see you tomorrow.